All right, we are live now. Let me verify if I'm audible or not. Okay, perfect. So I'm audible, everything is fine. Let's start the discussion. So how are you everyone? So I know many of you are watching from your app and etc. So attendance का time पे आ जाते हो. ठीक है, कोई दिक्कत नहीं. So anyways, so today we'll be discussing which subject? Pediatrics. So pediatrics के लिए देखो यार pediatrics ना when we are talking about exam point of view, so let me be very honest, brutally honest. तो अब तक जो पढ़े थे आप लोगों ने whatever you have studied so far that would be sufficient. Just go through once from this revision video, that will be sufficient. Here I have taken my own notes of pediatrics which I have put up, and the complete notes I'm trying to revise within these 3 hours. Okay, now with this much being said, देखो यार, the thing about pediatrics is you can never be sure. Like, you know, sometimes what happens is that pediatrics they say 7 question 8 questions will come. Sometimes ऐसा होता है कि पेपर पूरा ढूंढ लो, छान मार के ढूंढ लो, you search it however you want, you won't even find one pediatrics question. So वैसा भी हो सकता है, that is one possibility. Another possibility is that they'll go up to 6 to 7 questions. This is a possibility number 2. So these are the possible ways what we can get in the pediatrics questions. Okay, so among the pediatrics questions, so what are the important things? Sir, अगर हमें pediatrics अगर अब तक पढ़े ही नहीं है, we haven't studied at all, what are we supposed to do? You go through this revision video, that will be sufficient. But if at all you want me to tell you some specific topic, the most important topic from the pediatrics you must master it is congenital heart defects. ठीक है जी, congenital heart defects is the one you must, like, you know, you should be very accurate about it, and rest everything you can manage. Earlier times was there used to be, there may be one question, may not be one question from your milestones. Okay, तो milestone उतना मतलब 4-5 पेज का या 3 पेज का milestone fully you have by hearted, at the end of the day you didn't get one question also, then it will be disappointing. So rather than wasting your time on such kind of things, even with the IPC, some students do one thing that they'll make a big list of IPC and keep it इधर उधर पूरा रटने लगते हैं. At the end of the day एक भी IPC नहीं दिखता है. ठीक है, so that is what is the problem. So that times what we are supposed to do is that we are just want to go through that once and don't waste our time much. Okay, so with that much being said, चलिए शुरू करते हैं. तो whoever is watching, just drop me a message if audio video everything is clear, able to follow me or not. कुछ तो response करो, शुरू करते हैं. I'm waiting. All good? Okay, I'm considering that everything is fine and going forward. So when we are talking about pediatrics, so from the birth we have age, right? So in which age, what do we call the child? So we call the child from 0 to 28 days, means from the birth to first 28 days we call it as hello hi. So first 28 days we call the child as a neonate. We call the child as a neonate. First 28 days neonate. First 28 days neonate. So up to 1 year, from 28 days to 1 year, up to 1 year age of the child, we call the child as a infant. We call the child as a infant. 1 to 3 years we call them as a toddler, and 3 to 6 years preschool, and more than 6 years we call them as a school child, and more than 12 years or approximately 10 to 19 years we call the child as a adolescent. Here school age and adolescent age might be overlapping. So sir, which is the most important thing to be remembered? These are the two important, neonate and a infant. Neonate means what? From the birth to 28 days. Infant means first 1 year of the child. Okay, so let's continue. So in the neonatology, first 28 days of the life, what will happen to the birth? Okay, so at the time of birth, what can be there? The child can be normal vaginal delivery or preterm vaginal delivery, or it is possible is cesarean section. The most important, normal vaginal delivery is the term. Normal vaginal delivery is the normal we consider. Okay, now there are some specifications. So the specifications are what? So immediately at the time of birth, the child will have some like, you know, like, you know, size, shape, length, okay, head circumference, these and all is very important. So normal length of the baby is about 50 centimeters. The length of the baby is about 50 centimeter. 50 meter नहीं, गलती से 50 meter मार्क मत करना. 50 meter मतलब 2-3 बिल्डिंग से भी ज्यादा ये हाइट हो जाता है. ठीक है, and head circumference again 35 centimeter. Head circumference is a 35 centimeter. This is very very important. Why it is very important? If large head is there, normal vaginal delivery is difficult. Okay, now Upper part of the body is about 1 is to 1.7. Upper part to lower part ratio 1 is to 1.7. Okay. So now the normal fetal heart rate, ये बहुत important है to solve MCQs, especially when they associate with the gynecology. Okay. Any time when we are talking about a neonatal heart rate or a fetal heart rate, that is again 110 to 160 beats per minute. Remember, 110 to 160 beats per minute at the time of birth, even at the stage of fetus. Matlab when the baby is in the mother's womb also, that time also heart rate is 110 to 160. Okay. So why we need to understand, अगर कोई एक केस सिनेरियो में if fetal heart rate if it is going less than 110, सीधा blindly याद रखो what is the diagnostic के लिए, तो आप लोगों को there are other parameters we are going to check for the fetal movements etc. But in the exam point of view, जब solve करोगे MCQ, fetal heart rate if it is less than 110 beats per minute, so directly you can call this as a fetal distress syndrome or a fetal distress, called as a fetal distress. Okay. Birth weight के ऊपर कहां से क्वेश्चन आते हैं? 100% MCQ can be asked from where? From the PSM side. So at the time of birth, the weight of the baby is about 2.5 to 3.2 kgs. 3.5 to 2.5 to 3.5 kgs. Up to 3.5 also considered normal. Even 4 kgs also considered normal. Okay. But why we need to know? If the baby weight is more, we call it as a sumo baby or a macrosomia. Macrosomia means the baby's size is very large. The weight is large and size of the baby is large. So that time normal delivery is not possible. Okay. चलिए, लो बर्थ वेट कब बोलोगे? लो बर्थ वेट if the weight is less than 2.5 kgs, very low birth weight less than 1.5 kg, extremely low birth weight is less than 1 kg. Remember, less than 1 kg is extremely low, less than 1.5 kg is very low, and low birth weight is less than 2.5 kgs at the time of birth of the baby. So what can cause this weight loss? So weight matlab what can cause this weight to be less? Birth weight, if it is, I have a child who was delivered at hospital, in my hospital for example, the weight of the baby is 1.5 kg. 1.5 kg, it is approximately nearing to the very low birth weight. So if there is very low birth weight, what can be the cause? The usually common causes are intrauterine growth retardation, such as for example placental insufficiency. Okay. And there is one more disease called as twin to twin transfusion syndrome. That time also क्या होता है? There are two babies, baby 1 and baby 2. Now what will be there? The lot of nutrition can go from baby 1 to 2. Now this baby will grow bigger and this baby will become smaller. Okay. So second baby will be smaller. So that time this baby will suffer for low birth weight and this baby will have higher birth weight, and one baby will be macrosomia, one baby will be extremely low birth weight baby, and antepartum hemorrhage and preterm labors can be the causes for your low birth weight. So what are the causes? IUGR, triple T syndrome, hello, APH and preterm. These are the causes for the low birth weight. Okay. So immediately after the birth, baby has to pass few things. What are the few things? What is first urine and first fecal masses? What is that? First stool and the first urine. So first urine should be passed within first 48 hours. First urine should be passed within first 48. Jai Shri Ram. So Jai Shri Ram. Okay. So what I'm trying to tell you is that first urine should be less than 48 hours. So immediately within first 2 days, baby must urinate. Okay. And within first 24 hours, baby has to defecate. Defecate means stools must be passed. The first stool will be very dark green color stool. First stool of the baby is always very dark green color stool. So that is only called as meconium. The first stool of the baby is only called as meconium. So this will be a green color stool because of the bile presence. So remember this very important point. Okay. Now, for example, we already studied this in surgery. I'll just go to tell you people quickly. If a baby does not pass the first urine, that means a high likely posterior urethral valve. Investigation of choice for posterior urethral valve and surgery. I taught you people MCU, and treatment will be surgical treatment. Initially, we put a Foley's catheter. Okay. For example, if a baby does not pass the meconium up to 3 days, then we need to suspect a disease called as Hirschsprung disease, absence of ganglions in the myenteric plexus. Okay. So for that, investigation of choice is suction rectal biopsy. For the length of the segment, we check for barium enema, and treatment will be Seven-Park operation, which you already studied from the pediatric sample. Though charge is first urine, first 48 hours, first stool, first 24 hour, first stool is only called as a meconium. Now meconium pass नहीं होता है तो Hirschsprung disease. If at all urine pass नहीं होता है तो posterior urethral valves. That is the end of story. Okay. So let's talk about the normal body temperature of the baby. The very sensitive parameter. Because sir ये क्या हो जाएगा सर, थोड़ा फीवर ही तो होगा ना, ऐसा नहीं होता है भाई. बहुत dangerous scenario when it comes to babies. Temperature is very dangerous thing. Very sensitive parameter. Please understand. ठीक है जी. तो normal temperature of the baby at the time of birth is 36.5 to 37.5 degrees Celsius. Okay. Now the dangerous enemy is what? Because when the baby is in the mother's womb, so mother is protecting the baby, the temperature is normally very higher, little bit higher compared to the normal. So temperature is more. Now baby comes out of the mother. Once baby comes out of the mother, what will happen? Baby is outside in the environment. In the environment, baby's body will give away the heat, give away the all the heat, majority by the mechanism of evaporation. So because of the loss of heat, baby can develop hypothermia कब बोलोगे? Whenever the temperature is varies between 32 to 36, we call it as a hypothermia. Okay. If it is less than what is that? Less than 32, then we call it as a severe hypothermia. Hypothermia can be the deadly cause for death in the children very quickly. Okay. Now the next important, if it is between these points, अब मैंने बोला कि 36 तक तो मैंने बोल दिया था, ठीक है. If the temperature is between 36 and 36.5, then we call it as a cold stress. Then क्या बोलते हैं उसको? Cold stress बोला जाता है. क्या बोलते हैं उसको? कोल्ड स्ट्रेस. ठीक है. सो व्हाट कैन कॉज द टेम्परेचर लॉस? मतलब मैंने बोला कि बेबी बाहर आते ही टेम्परेचर मतलब कम होने लगेगा. मोस्ट कॉमन वे ऑफ टेम्परेचर लॉस इज mechanism of evaporation means baby's body will evaporate all the water through giving the heat through the skin. Okay, so remember evaporation. Then there is one more thing, that is, what is that? Radiation means near the cold source. What do I mean by this? Very important, very easy to understand. मान के चलो, for example, here is the AC. The AC is there. AC is giving that temperature of 18 degrees centigrade. 18 degrees centigrade. Your body is having a temperature of 36 degrees centigrade. Okay. Now what your body will do? So body will give away the heat. Just body will radiate the heat. So it is same as that of अगर तुम लोगों ने खाना बनाते हुए, if you are cooking, that time what will happen is that you take the some vessel, whatever you used, you keep it outside. So surrounding the vessel there will be very heat, because the heat is given away by the given away by the heat, given away by the source itself. Okay, so whenever near the cold source, there will be radiation of the temperature, and there will be one more mechanism called as conduction and convention. So convention is due to cold air. Okay, then conduction is due to the touch of the cold surface. Radiation is near the cold source, and most common method of heat loss in the human body is evaporation. इसके बारे में क्वेश्चन पूछा गया था, evaporation के बारे में. Remember, most common method of weight loss in the children is evaporation. Okay, so please listen to me. So very important. Everything given to the neonate is also very important. Like for example, your vitamin K is given, and also BCG vaccine is given. Hello Dr. Mahi, hello Silent Life, and exam prep. Okay, तो कई लोगों का आपका मतलब पूरा नाम नहीं दिखता है यहाँ पे, sorry for that. Okay, तो याद रखो, what is that? That the time of birth for every children we are going to give vitamin K, BCG, oral polio vaccine. ठीक है. Now what is the first thing? Immediately at the time of the birth, what we are going to do is a kangaroo mother care. Kangaroo mother care मतलब क्या होता है? You take the baby immediately after the delivery, you put the baby on the mother's chest. Okay, so that is the first contact with the mother. So that will help in release of the oxytocin in the mother. That will help in the breastfeeding. Okay. Now, when you are not supposed to do a kangaroo mother care, this MCQ was asked. Okay, so MCQ was asked, very easy. If the mother is having a shock, hypovolemic shock, or this, if the mother is unconscious, if mother has sepsis, and if the baby has a very low birth weight, so these are நல்ல தெரியுமே, தமிழ் தெரியும், தமிழ் நல்லா பேசுறதுல என்ன, ತಮಿಳ್ மட்டுமா, ತೆಲುಗು ಕೂಡ ಬಾಗొచ్చు, ಕನ್ನಡನೂ ಸಖತ್ತಾಗಿ ಬರುತ್ತೆ, हिंदी में भी बोल लेता. Okay, so listen to me very carefully. Yes, what I'm trying to tell you people here is that, if the mother is having shock, sepsis and very low birth weight, do not give kangaroo mother care. Okay. So next concept. What is that? IUGR. IUGR. Thank you. IUGR. IUGR means intrauterine growth retardation. Intrauterine growth retardation. Okay. So also called as SGA, small for gestational age. Are very simple. So if the baby, so see at every stage, at this many weeks, baby should be this much growth. At this many weeks, baby should be this many weeks. That is the rule is there, right? So if less than that is there, then we call it as a IUGR baby. Okay. So ஒன்றும் பிரச்சனை இல்லை கேட்கலாம். Okay. So when we are talking about large for gestational age, कब बोलोगे? When you are going to say that if the baby's weight is more than 90th percentile, then we call it as a larger for the gestational age, called as a macrosomia. So we have microsomia and macrosomia, but microsomia word is not there. Rather we use IUGR, intrauterine growth retardation. Okay. So let's talk about the IUGR. IUGR, why it occurs? The most important points you must remember is, my dear students, why it will occur. If the placenta is not formed properly, see, the most of the nourishment to the baby comes from where? यार टेंशन मत लिया करो, अब ये पूरा नोट्स मतलब इसके अंदर कुछ तो नहीं, आई एम नॉट गोइंग टू ऐड एनीथिंग न्यू, राइट? सो आई विल शेयर दिस नोट्स इटसेल्फ टू यू पीपल at the end of our lecture from through the same description link. So do not panic or worry, just keep on listening to what I'm telling and try to understand. Okay. So if placenta is the only source of nutrition to the baby, right? If placenta is not there, then what will happen? So baby will have lack of, what is that? Lack of O2 supply. Lack of O2 supply, baby will have hypoxia and also hypoglycemia and hypocalcemia. Why? Because all the nourishment comes from the placenta. All of them are not there. Okay. So listen to me. If that is not there, now what will happen? Fetus will undergo, baby is not getting enough oxygen. So fetus will undergo distress, fetal distress. So yeah, during the distress, what can happen? Fetus can pass the meconium in the mother's womb itself. Then it can lead to, at the time of birth, meconium aspiration syndrome, which is only called as a hyaline membrane disease, which you might have studied from the gynecology as well. Okay. Now, if there is a hypoxia, my dear students, listen to me. If there is a hypoxia, what will happen is that baby is not getting sufficient amount of oxygen. So what baby will do? Baby will try to compensate. कैसे compensate करेगा? How will baby compensate? By producing more RBCs. If more RBCs is there, that is only called as polycythemia. We call it as a polycythemia. Okay. So polycythemia is increase in RBC, but we have one more condition called as polycythemia vera. Okay. Polycythemia vera is different from plain polycythemia. Plain polycythemia means baby is having high number of RBC over. Polycythemia vera is a type of malignant condition. Okay. All right. If there is no blood supply to the brain, automatically brain can also get injury. But the most important, if see baby is not getting सर ताकते नहीं हो गए मैं यार मतलब तकते नहीं हो क्या मतलब यार आई एम वेरी पैशनेट अबाउट टीचिंग इट्स नॉट अबाउट फॉर मी मोर देन मनी it's I have put in a lot of just since you told Asim, I'll tell this is the first time I think I'm telling this in front of my students. I have been doing this work around 6 to 7 years. Okay, 6 to 7 years. And मैं कितने भी डिप्रेस्ड हो कितने भी दिक्कत में हूँ whatever the problem I have in my life I don't mind, but when it comes to teaching I'm always interested. I'm always मतलब थकना वकना ये हमारा डिक्शनरी में नहीं है कि oh my god I'm too tired I can't take class. No, I will go to the extreme level. Okay. There are situation में क्या किया था कि इतना करने के पढ़ाने के बाद I was recording one subject for this thing. Okay. तो हमारे ऐप में रिकॉर्ड कर रहा था तो आई स्टिल रिमेम्बर मी एंड शुभम वाज रिकॉर्डिंग एंड रात 12 बज गए थे. शुभम बोला था सर आप पढ़ा रहे हो आपकी मर्जी है ना. तो मैं बोला हाँ ये भी तो है. ओके. फिर मैं पढ़ाया एक पॉइंट आ गया कि मैंने बोला भाई अब लग रहा है मैं थक गया हूँ तो मैं स्टूडियो पे ही लेट गया. ठीक है. सो दैट मच आई एम इनटू टीचिंग. आई वुड नेवर गिव अप ऑन दिस. ओके. इट्स लाइक मुझे ना बहुत जोश मिलता है. Anyways, let's come back to this thing. So what is this? See, brain को blood supply होनी चाहिए. So brain should have a blood supply. If placenta is insufficient, baby is not having blood supply. If blood supply is not there, there is no possibility of intracranial hemorrhage. So brain development is reduced and intracranial hemorrhage is also possibilities are reduced. Okay. Okay. So let's go to the next important aspect, that is the prematurity. Prematurity also can lead to small baby, that is the early delivery. Early delivery, again you find all these three things: hypoxia, hypoglycemia, hypocalcemia. So no development of the lung. Now listen to me, no development of the lung, point number one. Point number two, decrease erythropoietin and decrease of RBC, which will lead to anemia as well. Prematurity. Okay, thank you, thank you. So let's go to the next aspect. Next aspect, what is that? Reflexes. अब तक मैंने जितने पढ़ाए सर, whatever you taught us how to remember, यार बड़े simple logic है. क्या है logic? सुनो, the logic is very simple. The baby can be small, baby can be large. If baby is small, we call it as a IUGR, or small for gestational age. So what can lead to that? If baby does not get a nutrition. Why baby does not get a nutrition? Two possible. Baby जल्दी बाहर आ गया, that is preterm labor. And one more thing, placenta is not formed, story over. In all of them, same complaint: hypoxia, hypoglycemia, hypocalcemia. Story finished, but खत्म बात. ठीक है, चलिए आगे बढ़ते हैं. रिफ्लेक्सेस, बेबीज का रिफ्लेक्सेस इज आल्सो इंटरेस्टिंग थिंग, बट एज सच वी डोंट have questions asked, but देखो तुम लोग बच्चों के साथ जब खेलते हो ना, when you are playing with kids, right, we always tend to do the one thing, that we give our finger to the baby's hand. Okay, immediately what baby will do, it will hold the finger, it will be, आप finger हाथ में करो तो बेबी ऐसा पकड़ लेता है. ठीक है, यहाँ पे कितना क्यूट सा बच्चा पैरा सब पकड़ा हुआ है, देखो. सो इसी को बोलते हो, व्हाट इज द नेम ऑफ दिस रिफ्लेक्स? कॉल्ड एज ए ग्रास्प रिफ्लेक्स. ठीक है, ग्रास्प रिफ्लेक्स. ग्रास्प रिफ्लेक्स विल स्टार्ट इन द यूट्रस इटसेल्फ, मदर के अंदर ही. मतलब देखो इतना, मतलब ह्यूमन हाउ इट इज, हाउ वेल डेवलप्ड. ओके, किसी चीज को भी पकड़ लेते, जल्दी पकड़ने का इच्छा होता है इंसान को. ठीक है, सो इन द इंट्रायूट्रिन लाइफ 28 वीक्स itself, we will have the first reflex, grasp reflex. After the birth, up to 3 months it will be there. After 3 months only that can go off. So the normally up to 3 months grasp reflex will be there. This is also important point. So क्या याद रखना है यार? याद इतना रखो, grasp reflex बेबी को शुरू होता है बर्थ में, बर्थ से पहले ही. It will stay till 3 months. grasp मतलब holding something, he is holding. Okay, next one, what is that? That is called as rooting reflex. Rooting reflex will arise by birth, it will disappear in first 3 weeks itself. So when you touch one side, baby will try to bend to that side only. Okay, that is only called as rooting reflex. Again, rooting reflex, कोई दिक्कत नहीं. ठीक है, तो ग्रास्प रिफ्लेक्स याद रखो. देन देयर इज वन मोर थिंग, मोरो रिफ्लेक्स. मोरॉन रिफ्लेक्स नहीं है वो, मोरो रिफ्लेक्स. ठीक है, मोरॉन रिफ्लेक्स नहीं है, मोरो रिफ्लेक्स. It will arise by 28 to 32 weeks of the intrauterine life, disappear by 3 to 6 months. But most important aspect, what is this? This is only called as asymmetric tonic neck reflex. Asymmetric tonic neck reflex. You can look at the baby how the reflex is here. Okay, so baby is having tone, baby will turn to one side and point the tone at that direction only. So this will start at 35 weeks of intrauterine life, and by 6 months it will disappear. And the last and most important reflex is parachute reflex. What is that? Parachute reflex. So parachute reflex, you can understand only by remain for the lifetime. Parachute reflex will remain for the lifetime. Okay, remember this is the most important thing, it will remain for the lifetime. Okay, in the umbilical cords, all of you know from gynecology, 2 arteries, 1 vein. Okay, early clamping is done. Okay, stump of the umbilical cord will fall off on its own by 7 to 10 days. Okay, finished. But most important thing is the problems with the umbilicus. This is very commonly asked question, and मुझे पता नहीं क्यों everyone makes mistake. कैसा? नहीं, listen to me. Now you should not make a mistake. So the problems with the umbilicus are, the problem number 1 is umbilical hernia. Umbilical hernia, you can notice the picture here. Umbilical hernia is a MCQ which was previously asked also. What happens is that, so the contents from the stomach are coming out from the umbilicus, but the thing is that, look here, it is completely covered by the skin. It is completely covered by the skin. Again and again I'm telling you, it is completely covered by the skin. Up to 3 months it can be normal, so no treatment is required earlier. But later, if it is persist in the life, then we can go for a surgical treatment. And the next important aspect is omphaloceal and gastroschisis. What are these two things? From the umbilicus, all the content is coming out. Now, if you notice here, intestines are outside, but the most important thing, see, intestines are not freely falling off. Rather, it is covered by a peritoneum. If it is covered by a peritoneum, call it as a omphaloceal. Again, I'm telling you, covered by a peritoneum, omphaloceal. How to remember? There is a covering. In the covering, O is there. In omphaloceal also, O is there. This is one way to remember. Okay, this is one way to remember. The both are covered. Okay, then gastroschisis. Gastroschisis from the intestinal content come out, but the problem here is that from the umbilicus it will come out, but there is no covering of the peritoneum. The difference is omphalocele and gastroschisis. Peritoneum is present, omphalocele. If it is absent, gastroschisis finished. These three images are most important MCQs which are previously asked. Very important. Okay, let's go to the next one. Apgar score. Apgar score. What is this Apgar score? Apgar score, my dear students, maximum is 10, minimum is 0. What is the minimum? Minimum marks, like what is the marks you can get in any exam? What is the lowest mark for anybody? See, lowest mark for anybody is 0, right? 0, right? But in the GCS, lowest is what? Lowest is 3. Okay. So what exactly? There is a joke we used to tell. Okay. If any one of my friend, he had failed in one subject. Okay, one subject during the MBBS time. तो उसको 0 आ गया था. ठीक है. वो खुद आके बोलता है. He himself comes. Yeah, in Glasgow coma scale, even dead body gets 3 points. But how did I get 0 marks? Wow, what a comparison, my brother. Okay, so look here, the minimum score is 0, 0, and maximum score is 10 in a Apgar scoring system. Now, so when do we do? First time we calculate the Apgar score at 1 minute of birth, then 5 minutes of birth, and the third time we are going to calculate 10 to 10 to 15 minutes. Okay, so what exactly we are going to do? So we check for Apgar. A for activity, so we check for the muscle tone of the baby. P for pulse. G for grimace. G for grimace means when we put something in the mouth, how the baby is reacting. Okay, now appearance of the baby. So baby usually in which color? Pink color. Okay, mat bolo ki sir skin tone के ऊपर डिपेंड करता है. No, it is about the blood supply. Baby skin usually approximately pink, but rather in cyanosis it can turn into blue and there is a respiration. Okay, for each one of them, if anything is absent, then we go for 0. If mild, 1 point. If not, 2 points. Okay, so maximum points which we can get is 7 to 10. The 10 is a very good condition. So whenever you calculate Apgar score, baby should get 7 to 10 marks. Then only we can consider the healthy baby. If not, moderately depressed, or 0 to 3 means severely depressed. 0 means baby can be dead also. So at the time of birth, congenital anomalies, tracheoesophageal fistula, which I taught you people from the surgery, what will happen? There is a fistula which communicate the trachea and the esophagus. The most common type is this one, type C. So दुनिया के अंदर C type के लोग बहुत होते हैं. ठीक है, वैसे ही the most common type of tracheoesophageal fistula is type C, where lower esophagus connects with the trachea and esophageal atresia is there. Means esophagus is not connected to each other, rather the upper segment is not connected to lower segment, rather it is going into the trachea. So most common complication of this condition is aspiration pneumonia. This was also a MCQ which was asked earlier. What is the most common complication due to tracheoesophageal fistula? And also you can find a large gastric bubble. Okay, all right. So then let's go to the next condition. What we can get, these are all of them are surgical conditions. Again, I'm going to tell you people quickly. So what exactly? Congenital diaphragmatic hernia. So here this image represents very nicely. Look here, my dear students. This is the diaphragm here, red color, whatever I'm pointing. So there is an opening in the diaphragm. Because of that, all the contents, liver and also your intestines are going into the chest cavity. Once they go into the chest cavity, now what will they do? They occupy all this area, intestines. Now they will put the compressor lung. Now in the baby, during the development of the baby, will this lung be able to develop? Yes or no? Lung development hoga ki nahi hoga? Lung development will not be there. If there is no lung development, what will happen? One-sided lung will be small, so it will lead to pulmonary hypoplasia. Plasia means formation, hypoplasia means less formation. So one lung is abnormally formed. In the X-ray, you can find like this. This image, if you get like this is a very important image. Iske andar bhi there is one this thing. Okay, so we were doing like earlier times now for FMGE, nobody used to teach this congenital diaphragmatic hernia. मुझे ना कहीं से तो लगने लगा था एग्जाम से पहले. One exam was there. Before the exam, I got this feeling that नहीं, congenital diaphragmatic hernia they will ask. Okay, so what I did in the last day I went to coaching and I said, sir मुझे 10 मिनट का टाइम दे दो, मुझे कई टॉपिक्स रिवाइज कराना है. I took the 10 minutes and in that I added this new one to them and I showed this image. If you look at this image, just directly mark congenital diaphragmatic hernia. बहुत लोग आके बोलते हैं कि सर अगले दिन तो हमें पहला क्वेश्चन वही मिला. First question was that only. So that much important topic this is. If bowel loops come into the intestine, then it is only called as congenital diaphragmatic hernia, because of which lung is not developed, pulmonary hypoplasia. Okay. So treatment, what we are going to do for the feeding, we can give a NG tube, no problem. But the most important thing is that immediately we have one interesting thing. Oh, lung is not developed. Give the baby oxygen. Okay, we will give the baby into a positive pressure ventilation. भाई लोग ये सर्कस मत किया करो. You can never give positive pressure ventilation because one lung itself is not developed. If you put more pressure and if you send the air forcefully, this part of the lung will tear up. Okay, so that is why no positive pressure ventilation. Positive pressure ventilation is absolutely contraindicated. That include PPU is absolutely contraindicated. Even bag and mask ventilation also contraindicated. This is a very commonly asked question. And what is the treatment? We are going to do the treatment with the help of something called as ECMO. ECMO मतलब होता है एक machine होती है. It works as a heart and lung of the person. Especially what will it do? It will take the dialysis, पता है ना? Dialysis, you know, right? Dialysis, it will take the blood, purify and put it back. Like that only, it will take the blood, it will put the oxygen and put it back into the body. That is only called as ECMO, extracorporeal membrane oxygenation. Okay, then we are going to go for a surgical repair. So we have two types of surgery. So we have Morgoni repair and also we have Boda-Hex repair. Okay, so in that, which one is important? Morgoni, if you want to remember, Morgoni is important. Okay, so let's go to the next one. There is something called benign problems of the newborn. Means immediately after the birth, babies will have these conditions, but they are absolutely physiological. Means self-limiting, no treatment is needed. If I give any of these things, if I tell you whatever I'm going to tell, melia, whatever the conditions I'll tell, all of these things are benign condition, does not require any treatment if they're self-limiting. So the first one is called as melia. Melia means, you can look at this picture here, the sebaceous glands of the baby has been dilated in the skin. So dilated sebaceous gland in the skin are only called as melia. Melia is a self-limiting condition, does not require any treatment, बहुत important. सर कोई भी सर्जरी के लिए, we do the surgeries immediately after the birth. Nowadays we are attempting the procedures to do it when the baby is in the mother's womb itself. So there is no rule for this, but there are some procedures which might require some time, but there is no rule that कि इतना time के बाद ही baby को surgery कर सकते हैं. ऐसा कुछ भी नहीं है. There is no such thing. Okay, nowadays yes, अगर तुम्हें कोई बोलता है तो बोलो कि भैया जाके पढ़ लो करके. आजकल का time पे we are trying to do the surgeries when baby is inside the mother's womb only. Okay, please remember this. So there is no rule. For example, you have congenital heart defects such as the transposition of great vessel. वहाँ पे immediately at the time of birth only we are supposed to do the surgery. Okay, so that is the thing. So we are going to stratify इसका what is the benefit of surgery, what can happen without surgery. If the baby will die without surgery, immediately we are supposed to do. एक सेकेंड. No, see, ये दिक्कत होता है कि see, I'll tell you. So यहाँ पे I can notice many of the students are watching from the app. Okay, Meduhub app से देख रहे हैं, तो वहां से वो लोग कमेंट लिख नहीं पा रहे. एक तो वो है, एंड दूसरा है कि मतलब बेस्ड ऑन द नंबर ऑफ सब्सक्राइबर हो जाता है. इट्स ओके, बट आई एम एनर्जेटिक ना, यू डोंट वरी अबाउट इट. एंड एक्चुअली आई वुड रेकमेंड यू पीपल, यार इतना सब कुछ मतलब एंड मोमेंट में तुम्हें मेडिहब से मिल रहा है ना, यू शुड रेकमेंड ऑल ऑफ यू शुड रेकमेंड दिस टू योर जूनियर्स फॉर स्टडिंग एंड फॉर लर्निंग. ओके, क्योंकि हम लोग तो फ्री में बांट रहे हैं भाई, मटेरियल फ्री में बांट रहे हैं, कंटेंट फ्री में पढ़ा रहा है. ठीक है, तो अभी के लिए फिलहाल के लिए तो हमारा ऐप के अंदर तो बराबर पड़ा है कि फ्री ऑफ कास्ट कंटेंट भी मिल रहा है अभी फिलहाल के लिए. तो so you can utilize it even after the exam also. Okay, thank you so much for that. I understand what you are telling. Thank you my dear. Now चलिए आगे बढ़ते हैं. नेक्स्ट वन, Epstein pearls मतलब in the baby's mouth the pearl like appearance can be found. These are made out of keratin. These are only called as keratin pearls, which are white color. इसको कुछ treatment करना है, do you have to do any treatment? You don't have to do any treatment for Epstein pearls. Then there is one more thing that is called as rashes. So most common rash of the newborn is called as erythema toxicum. Erythema toxicum. So why this toxicum occurs? Because the rashes will come because eosinophils will deposit. So the condition, this is also a self-limiting condition, does not require treatment. Erythema toxicum does not require treatment usually, but it is due to what? It is due to eosinophil deposition. तो आपको क्वेश्चन पूछेंगे तो a child immediately after the birth developed erythema toxicum as given in the as given in the picture. And what is the pathology behind it? Eosinophilic deposition. Eosinophilic deposition. So here, see, the thing is, we also grow with the time. हाँ, अरे सी हर चीज के लिए होता है एक। देन द नेक्स्ट वन इज द ब्लू कलर स्पॉट्स ऑन द बेबी। ये देख के मत सोचना कि ओ माय गॉड कुछ तो हो गया इसको, कुछ नहीं हुआ, नथिंग हैपेंड टू द बेबी। दीस आर कॉल्ड एज मंगोलियन स्पॉट, दीस आर कॉल्ड एज मंगोलियन स्पॉट्स। दिस occurs because of excessive melanocytes in one area. Usually bluish pigmentation will be there, usually bluish pigmentation will be there, okay? So these are the condition। तो क्या क्या है? मीलिया नो ट्रीटमेंट, एप्स्टीन पल्स नो ट्रीटमेंट, erythema toxicum no treatment, mongolian spot no treatment। These are the conditions which does not require treatment। Let's go to the next aspect. What is that? So whenever we are talking about in a normal female, what will happen? Vaginal bleeding in the newborn। So listen to me, in the normal female after the birth, per vaginal bleeding can be there। ये देखो यार, immediately after birth only baby is having a per vaginal bleed, okay? ये क्यों हो सकता है? It can be due to hormones of the mother। So हम लोग already delivery has occurred। If delivery has occurred, so mother is not giving any blood supply or none, like hormones anymore। So now what you are supposed to do? You don't do anything, just wait and watch। This is also a normal thing, okay? Mongolian spot is also normal thing, and female at the time of birth normal vaginal delivery. After that, if the female child also can develop a per vaginal bleeding, that is also normal, okay? Then let's talk about the next one, caput secundum and caput hematoma। What is this caput secundum and caput hematoma? So these are the caput secundum and caput hematomas। So what happens is that when we use vacuum assisted delivery, 3 idiots, all of you watch 3 idiots। वो बनाता है ऐसा सक्शन बना के वही घुस के डिलीवरी कर देता है ना? So what exactly is that? So please listen to me। See, that depends individually. Some child with grow up, it might take a lot of time. In some children, it will go off very quickly. So that is why we don't have a disappearance time. Okay. So caput secundum and caput secundum or caput succedaneum, and what is that? Hematoma. So what happens here is that during the vacuum assisted delivery, it will occur. Okay. So what is it? Caput succedaneum. Caput succedaneum is fluid accumulation. Okay. But caput hematoma, blood accumulation will be there. Now, where is what accumulated? Remember, between the aponeurosis and skin, between the aponeurosis and skin. So you have scalp, right? Scalp, skin, okay, aponeurosis. So between the skin and aponeurosis, we have scalp, right? Okay, so what is there? What is there? So between the skin and the aponeurosis in this area, if there is a fluid accumulation, we call it as a caput succedaneum or secundum. Okay, so it is seen with the vacuum assisted delivery, and it will always cross the suture line। मतलब in the center we have a suture line na? So since it is associated with what? It is associated only between the scalp and the aponeurosis, it can cross the suture line। Okay, नहीं नहीं, मैं देख रहा हूँ क्या हो गया, कुछ मिस किया मैंने। मैंने बता दिया ना मंगोलियन स्पॉट्स का। डिड आई मिस एनीबॉडीज रेस्पॉन्ड? मैसेज तो देख रहा हूँ मैं। ओके, देन वी हैव वन मोर थिंग, दैट इज योर कापुट हेमाटोमा। कापुट हेमाटोमा में पेरियास्टियम एंड क्रेनियम के बीच होता है, पेरियास्टियम एंड क्रेनियम के बीच होता है। सो फॉर यू पीपल टू अंडरस्टैंड दैट, लेट्स सी। सो हियर वी हैव लिसन टू मी, listen to me, here we have one of the most important in cephal hematoma or caput hematoma। Here if you notice, this is the suture line and here is the hematoma, it is never crossing the suture line। But here if you notice, caput succedaneum, what is happening? It is crossing the suture line, it will cross the suture line, and the next important point to be remembered is it is a fluid accumulation। Now here if you see blood accumulation, so this is the story of your caput hematoma and caput succedaneum। Okay, so let's go to the next condition, that is only preterm. Preterm, what are the causes for the preterm? So causes for the preterm delivery is polyhydramnios, all of you know, torch infection, drugs, okay? Then trichomonas vaginalis, this is also a very important, okay? Hello भैया, कैसे हो? So Trichomonas vaginalis, Trichomonas vaginalis. Now listen to me, very important one. What is this I'm trying to tell you? So this is a very important MCQ which is asked from the OBG also. Which urinary tract infection can cause the preterm labor? Preterm labor can be caused by your Trichomonas vaginalis. कैसे हो भैया? So the last one is preterm rupture of membrane. Preterm rupture of membrane, that can also lead to what is that? Preterm labor. Preterm labor. Okay, so let's go to the next important aspect. यहाँ पे हम लोगों को MCQ बहुत important है, trichomonas vaginalis. Okay, so whenever preterm delivery is there, now normally baby will be pink and dry. Normally baby will be pink and dry, but pale pink, shiny will be there. Okay, so what happens is that can also be seen in the term baby also. Okay, now listen to me. So slow recoil of ears, what do I mean by slow recoil of ears? So when you do this to the ears, ऐसा करके छोड़ोगे तो ईयर क्या हो रहा है? पीछे चले जा रहा है. But in the preterm baby, if you do this, ears will go back slowly. That is point number one. Then next important is soles. Soles have a superficial piercing, means piercing of the sole will not be completely formed. There will be lunago. Lunago means body hair, very fine, soft, unpigmented hair, very fine, soft, and very thin, unpigmented hair in a baby. In the preterm labor, we call it as a lunago, and breast buds will be smaller. Okay, birth weight will be less, lungs not matured, low Apgar score. So these are the things of preterm labor baby can have. Okay, so कैसा याद रखें सर? preterm labor है ना. So preterm labor हो गया. Preterm labor का causes like torch, polyhydramnios, prom, then trichomonas vaginalis. Okay, so preterm baby बाहर आएगा तो immediately baby will be very dry and slight pink, or it can also be pale. Okay, then if you look at the ears will not recoil. Okay, body will have a small fine hair like appearance but non-pigmented, superficial casing of the palm and soles. Birth weight, to all of you know, lungs are not mature, birth weight will be less, so the because of which Apgar score is also less. So these are the symptoms of preterm labor. Let's go to the next condition called as a birth hypoxia. Okay, so birth hypoxia, that is your asphyxia. Okay, so during the time of delivery, बहुत ध्यान से सुनिए सब लोग. During the time of delivery, so there were 4 stages of labor: dilation, delivery of the baby, delivery of the placenta, monitoring. Among which, during the second stage of the labor, baby is passing through the mother's birth canal. When baby is passing through the mother's birth canal, and if baby does not come out quickly, or there is a tangling of the umbilical cords, if such thing is there, immediately baby will have what? During that time, baby will not have a sufficient amount of oxygen, so immediately baby will develop asphyxia. Okay, so the hypoxia will occur due to kidney. It can lead to renal failure. That is the least important thing. If it occurs to the brain, most important, it will lead to hypoxic ischemic encephalopathy. If it is happening to intestine, mesenteric ischemia. But most deadly and dangerous one is the ischemic encephalopathy, hypoxic ischemic encephalopathy. Why birth hypoxia will occur? Because prolonged labor. If labor is going very slowly, or early detachment of the placenta got separated quickly, now still baby is under the delivery, baby is not breathing, so automatically no oxygen. So cord around the neck, uterus atony, and anesthetics and opioids, especially opioids, if given for the painless labor, they prolong the second stage of delivery. So in this condition, metabolic changes, what and all you can find anywhere during the birth. If nourishment is cut down even for a little bit of 1 minute also, baby can develop all these problems. So what are the problems? Baby will have hypoglycemia. Then baby will also have hyponatremia, hypocalcemia, and of course hypoxia will be there. So all the hypos, glycemia, magnesemia, hypocalcemia. So these two things, hypoglycemia and magnesemia, if they go to very severe condition, they both can lead to seizures, my dear students. Clear? So let's go to the next one, HIE, hypoxic ischemic encephalopathy. Hypoxic ischemic encephalopathy ka most common feature is seizures. Why? Because lack of blood supply to the brain. So in the brain, where exactly, if blood supply is lack, blood supply is cut down. If blood supply is cut down, now question comes, sir, कौन सी area suffer करेगा? यार blood supply अगर cut करोगे, there in every organ we have watershed areas. So the areas which will have minimal blood supply in one particular organ, in that area there will be infracts. Okay, तो मैनेजमेंट क्या करनी चाहिए? सो मैनेजमेंट करने के लिए आप लोग सोच सकते हो, हाइपोग्लाइसेमिया है तो ग्लूकोज देना चाहिए, हाइपोनाट्रेमिया है सोडियम देनी चाहिए, हाइपोकैल्सियमिया कैल्शियम देना चाहिए, हाइपोक्सिया ऑक्सीजन देना चाहिए. सो दैट विल बी द ट्रीटमेंट. सो मैनेजमेंट विल बी कैल्शियम, डेक्सट्रोज, नॉर्मल सेलिन, बट डू नॉट यूज द स्टीरॉइड्स because steroids have a tendency to increase the intracranial pressure. That is danger for us. Okay, all right. So So there will be infracts. Because of the infract, please listen to me. There is one thing. All the gyri and sulci will develop into eulygyria. Eulygyria. Eulygyria matlab mushroom like gyri. Mushroom like gyri. In this picture, you can notice here the gyri is going very deep, called as a eulygyria, also called as a mushroom gyri. Mushroom gyri. Okay. So this is a very very important point which was asked very frequently. Again, eulygyria is seen with what? Eulygyria is seen with HIE. याद रखो इतना तो याद रखा करो ठीक है. Then there will be one more thing called as periventricular leukomalacia. दो word याद रखा करो. What is that? Periventricular leukomalacia and eulygyria are the two important changes you can find in the imaging of a patient who is having what? Very good. Who is having a ischemic encephalopathy. So this is the periventricular leukomalacia. What do I mean by periventricular? यार आप लोग टेंशन ना लिया करो. ओके मैं हूँ यहाँ पे. आप लोग कोई टेंशन लेने का जरूरत नहीं. Anywhere if they tell you leuco means white color. What they are telling? Periventricular, around the ventricles of the brain. Around the ventricles of the brain. Here you have a ventricle of the brain, so you can very clearly notice what is that? White color. Periventricular leukomalacia. यहाँ पे भी देखो around the ventricles white color changes मिल रहे हैं. So white color changes around the ventricle seen after asphyxia of the baby is correct direct indicator of hypoxic ischemic encephalopathy. That is only called as a periventricular leukomalacia. Okay. All right. So for the preterm baby, sometimes what we will do is that immediate preterm baby delivery is occurred. So we tend to have one tendency. अरे baby ना जल्दी मतलब अच्छे से दूध पिलाएंगे तो baby will grow faster. But remember in the preterm baby, what will happen is that there can be what can happen is that no feeding because it can lead to necrotizing enterocolitis. Okay. So why? Please listen to me. Birth. So at the time of birth we cannot do the breastfeeding because of which we used bottle feeding. Bottle feeding से क्या हुआ? Infection हो गया. Infection कहाँ पे हुआ? Intestine में हुआ. So if there is a infection in the intestine, it can lead to sepsis. Of course, any infection can lead to sepsis. In the intestine, necrotizing enterocolitis. Okay. In the intestinal wall, necrosis of the intestinal wall will occur. तो पहले क्या होता है? Bottle feeding. Bottle feeding के वजह से intestine infected. So because of which what can happen? The intestine can undergo infection and necrosis. So because of that, blood in the stools. What is that? Blood in the stool, and also abdominal distension will be there and decrease of peristaltic sounds. तो मतलब क्या हुआ? Very simple. Bottle feed करवाए. Bottle feed के अंदर बैक्टीरिया था. वो गया, it went to the intestine, infected the intestine. Once it infected the intestine, क्या होता है? Intestine will undergo necrosis. जैसे ही intestine necrosis हो जाएगा, gas etc बनेगा, that will distend the abdomen. Because of the necrosis, stools के अंदर blood आएगा. If intestine itself is necrotized, so where will be peristalsis? Peristalsis will be absent, so leading to decreased peristaltic sounds. Okay. All right. Let's go to the next one. Staging of NEC, necrotizing enterocolitis. We use a staging called as Bell's staging. Bell staging. In the Bell's staging, the stage 2 is important because stage 2 has some important MCQs. In the Bell staging, we have something called as the pneumointestinalis. We have pneumoportalis, pneumoperitoneum. How to remember? Sir, very simple. If you consider this is the intestine. This is the intestinal wall. In the intestinal wall, what will be there? Air gas bubbles will accumulate. In the intestinal wall, not in the intestinal lumen, but in the intestinal wall, the gas will accumulate, called as pneumointestinalis. Pneumo means air in the intestine. So pneumointestinalis, that is only stage 2A. Okay. Followed by this air slowly will enter into where? Into the portal vein. Called as a pneumoportalis. But after some point what can happen? That can rupture and air can just freely present in the peritoneum, called as a pneumoperitoneum. Pneumoperitoneum is the stage 3B, stage 2A and stage 2B are pneumointestinalis and pneumoportalis. Remember, these are also questions which were previously asked. Okay. So most important, यहाँ पे पूरा staging है, इसके अंदर याद रखा करो. Important is second stage is the most important thing. Okay. So let's go to the next one. Any baby with a preterm or asphyxia, the baby can have what is that? Necrotizing enterocolitis. That where what staging we use? Bell staging. HIE, we are going to use a staging called as Levin staging. Again, the stagings are not important for us. Names are important. Levin staging is used. Okay. Let's go to the next condition. What is that called as? neonatal seizure. Neonatal seizure means the baby will have a seizures immediately after the birth. So most common cause of the neonatal seizure is HIE, hypoxic ischemic encephalopathy. Just now we discussed as a result of birth asphyxia. Okay, then there can be hypoxia. If the hemorrhage in the brain hemorrhage, okay, then hypocalcemia, if the baby has meningitis, and if the baby has fever, that is febrile seizure. Okay, so all of them are possible. Okay, so neonatal seizure we can consider phenobarbital, but not always. Okay, hypocalcium is causing the seizure. First investigation is serum electrolyte. Treatment will be supply with the calcium. If febrile seizure are there, if the febrile seizure is there, then per rectal diazepam is given. Okay, so based on the cause, if meningitis is there, treat the meningitis. Okay, so based on the cause, we are going to treat them. But the important thing is you need to know the causes for the seizures. Okay. Let's go to the next one, jaundice of the baby. So in the jaundice of the baby, there are two types of jaundice, physiological and pathological. What do I mean by physiological? What do I mean by pathological? See, physiological jaundice is such type of jaundice which will come and go, disappear on its own. But pathological jaundice, it will be due to some other condition or some other disease which we will discuss in some time. Okay. Normally, physiological jaundice will not appear immediately at the birth, but physiological jaundice will come at day 3. Physiological jaundice will come at which day? Which day? Third day after the birth. It will disappear on its own by 6th day. Okay. If it is a preterm, it will appear on the day 4 and disappear by day 10. So again, these are what? Physiological jaundices. It will disappear on its own. So here, if you look at this, total serum bilirubin level, this is a very, very important point. Total serum bilirubin level should be less than or equal to 15. So physiological jaundice, at least remember the term, appears on the 3rd day, disappear by 6th day. Total serum bilirubin should be less than or equal to 15. If any of these things appears on the 1st day, if it persists for more than 2 weeks, appears like total serum bilirubin is more, that time we consider as a pathological jaundice. So pathological jaundice का causes क्या होता है? Very important cause is RH incompatibility. RH incompatibility. All of you studied. ये भी वो incompatibility. Okay. Cretinism means what is that? Congenital hypothyroidism. Okay. Then if the baby has a hepatitis, along with that there are other diseases such as Dubin-Johnson syndrome and also Rotar syndrome. So what is this? This is a condition where there is a congenital defects of what? Biliary channel. Because of that, baby is having a jaundice. Remember, Dubin-Johnson syndrome and Rotar syndrome, in both of them, the type of bilirubin elevated is conjugated bilirubin, which is a conjugated bilirubin. How can you remember? You remember it with a mnemonic. Doctors do conjugation. अब सर इसका मतलब क्या है? Don't ask me the meaning of the mnemonic. I will teach you the technique of the mnemonic. D for Dubin-Johnson, R for Rotar, C for conjugated bilirubin. So Dubin-Johnson and Rotar syndrome are the hepatic jaundices in which elevated level of what is that? Very good. Elevated level of your conjugated bilirubin. Okay. Let's go to the next one. So breast milk has some enzyme. So physiological jaundice, first let's talk about the physiological jaundice. What can cause a physiological jaundice? One of the reason is from the breast milk. So breast milk will have some enzymes, and also intestinal bacteria will also produce an enzyme called as beta glucuronidase. The name of the enzyme is beta glucuronidase. It will convert unconjugated bilirubin to conjugated bilirubin. Now this conjugated bilirubin will accumulate in the body, leading to a jaundice. Okay, so that is the first point to be remembered. Then next, in physiological, remember, during physiological jaundice, one reason is enzymes, but this is due to one reason. But overall, most common bilirubin elevated in the physiological jaundice. Sir, इतना सब बताए, अब क्या है? भाई इतना याद रखा करो, physiological jaundice में finally overall major bilirubin elevated will be unconjugated bilirubin. That's it. Okay. So let's talk about the diseases in which unconjugated bilirubin is elevated in RH incompatibility, ABO incompatibility, Crigler-Nazar syndrome. Crigler-Nazar syndrome में होता क्या है? There is a deficiency of an enzyme called as UDP-GT, UDP glucuronil transferase. जब UDP glucuronil transferase is not there, the UDP glucuronil transferase is not there, so automatically unconjugated bilirubin will be increased. Crigler-Nazar will have a very, very bad outcome usually, but if we are using the drug of choice is phenobarbital. In conjugated bilirubin, doctors do conjugation, that is Dubin-Johnson and Rotar syndrome, which we have discussed. So again remember hemolytic anemia. Hemolytic anemia में भी कौन बढ़ता है? Increase of unconjugated bilirubin. Okay. चलो आगे बढ़ते हैं. तो अनकॉन्जुगेटेड बिलिरुबिन का सीन क्या है? अनकॉन्जुगेटेड बिलिरुबिन, माय डियर स्टूडेंट्स, फैट सॉल्युबल होता है. एवरीबॉडी ओके विद द स्पीड या स्पीड ज्यादा हो गया? सी मतलब मुझे ये बोला गया कि एग्जाम से मतलब क्या बोलते हैं, व्हाट टू टेल, एग्जाम से like few 1-2 days before the exam, so I think I have to be speed. Hopefully it's for perfect. Okay, I'm getting response like okay, right? So conjugated bilirubin, whenever conjugated bilirubin, ये fat soluble होता है. Anything fat soluble can cross the blood brain barrier, so it will deposit in the brain, leading to damage of the brain called as kernicterus. So what is that called as? What is that called as? Kernicterus. Okay, so remember kernicterus. Now basal ganglia damage, if the kernicterus, because of the deposition, if the basal ganglion is damaged, then we call it as a status marasmatus. Okay, let's go to the next disease, that is in the neonatal jaundice. Nowadays we don't use this law of Kramer rule is not used, so don't study this. Okay, Kramer rule is not used anymore. Okay, let's go to the next important aspect, that will be your cardiovascular system. Now when we are talking about cardiovascular system, please listen to me. First let's start with the embryology. Already you studied from the anatomy, but I will do from the pediatrics once again. Okay, so first organ to develop is heart. At which week? Third week. At which week? Third. So listen to me. After that, we have one important structure called as, truncus arteriosus. Listen to me. एक होता है कौन? Truncus arteriosus. From the truncus arteriosus, we get aorta and pulmonary trunk. So aorta and pulmonary trunks कहाँ से आता है? aorta and pulmonary trunk कहाँ से आता है? ये आता है from the truncus arteriosus. You can remember it with the mnemonic TAP. Okay, T for truncus arteriosus, artery and pulmonary trunk. Okay, then we have one more structure called as venous sinuses. Venous sinuses it develop होने के बाद हमें superior vena cava and inferior vena cava and superior vena cava will be developed. Okay, then we have one more thing called as bulbus cordis. Now bulbus cordis will allow the development of major part of the right ventricle. Okay, and outflow parts. Okay, outflow parts of the left and right ventricle. And we have one more thing called as a primitive ventricle. Primitive ventricle will develop into left ventricle. Primitive aorta will develop into right atria and left atria. So baby, when we are looking at embryology, here we have all of these things. We have truncus arteriosus, we have bulbus cordis, we have ventricles, we have atria, then we have what is that? Venous sinuses. A structure will be there like this. It will develop itself into cardiovascular system. इसको क्या develop में होता है? It will develop itself into a cardiovascular system. ठीक है? So that is the story of your, what is that? Story of your development. So development के अंदर क्या क्या important है? So remember आप लोगों को primitive ventricle will give left ventricle, primitive ventricle will give left ventricle, primitive atria will give right atria and left atria, and here truncus arteriosus will give aorta and pulmonary trunk. These are the very important questions which are asked from the anatomy. Okay, then let's go to the fetal circulation. Here fetal circulation अगर आप समझोगे नहीं तो आपको congenital heart defect समझ में नहीं आएगा. ठीक है? So first and most important, let's start with the very basics, but I'll go with the same speed only. Listen to me. So when the baby is in the mother's womb, right? Baby is in the mother's womb. Now what is happening when baby is inside the mother's womb? Now baby is not breathing, means lungs are not working. If lungs are not working, so normally what will happen? Blood from the right ventricle goes to the lungs. From the lungs, it will go to the left atria. From the left atria, it will go to the right ventricle. But the lungs itself is not working, right? So pulmonary circulation is not there. Since pulmonary circulation is not there, so exchange of the blood has to take place different way. So first and most important, fetal lungs are not working before birth. So high pulmonary vascular resistance. Okay. So what will happen is that between your right atria and the left atria. Now listen to me, very important point. Right atria will have high pressure. Right atria will have high pressure. कहाँ पे होता है? fetus में not after birth. कहीं ये मत बोल देना कि after birth right atria has high pressure. No, before birth right atria has a higher pressure. So here we have a valve called as foramen ovale. So this will communicate between the right atria and the left atria. Okay, so atrial septum will have, see atrial septum भी ना, ये भी बहुत interesting. other septum ऐसा है ना, consider these are the two atrias. Okay, half of the septum will come from up to down, half of the septum will go from down to up, and it will work like a valve. So that is only foramen ovale between the septum primum and septum secundum. Primum and septum secundum. Then we have next condition, that is ductus arteriosus. Ductus arteriosus, connection between the pulmonary artery and the aorta. So what exactly I'm trying to tell you? Listen to me very carefully. Now, the blood from the right atria, we'll start from the right atria, then we'll come back to the right atria. We'll try to understand. Okay, blood from the right atria will go to right ventricle. Right ventricle. So blood from the right atria goes to right ventricle. From the right ventricle, normally where it will go? Pulmonary artery. Okay, but pulmonary artery it will go, but lungs having a high vascular resistance, nothing can happen. So from the pulmonary artery, what will happen? It will go to the aorta. Pulmonary artery, it will go to the aorta with the help of a communication called as a ductus arteriosus. So normally, listen to me, we have a aorta like this. Okay, and we are having a pulmonary artery. Both of them will have a communication. Since lungs, the pulmonary artery is connected to the lungs are not working. Blood from the pulmonary artery will go into the aorta with the help of ductus arteriosus. But all this duct should disappear after the birth. Okay, now from the right atria, blood can also go to where? Left atria. From the left atria, it will go to left ventricle. From the left ventricle also it can go to aorta. So that is happening with the help of what? Foramen ovale, which I discussed here only. So there are two major communications. What are the two major communications? One is ductus arteriosus, one more is foramen ovale. Okay. After the birth, first thing what baby will do? Usually babies cry means first respiration means lungs are working. Okay, lungs start to work. Okay, now what will happen during the during the normal delivery? All the amniotic fluid will come out on its own, because a lot of pressure in the birth canal, maternal birth canal. Okay, if C-section is there, we can encounter something called transient apnea. Again, they are not so important. In which condition we can get transient apnea, cesarean section. Okay, so let's go back. Pulmonary vascular resistance in the lung is reduced. Once pulmonary vascular resistance in the lung is reduced, the circulation will become like adult circulation, So all this foramen ovale and also your, what is that? Very good. That is your ductus arteriosus must be closed. So foramen ovale closes immediately after the birth. Okay, immediately after the birth means physiological closure. See, very simple. Physiological closure means that valve was functioning, the function will be closed. Okay, but anatomically it will remain as something called as fossa ovalis. We will have fossa ovalis. Anatomical closure will occur 3 months in the form of a fossa ovalis. Means foramen ovale after closure becomes fossa ovalis. Clear? All right. Now, ductus arteriosus, see, physiological closure and anatomical closure means, so there was one valve which was connecting, right? So the valve will shut down, but it is like, still it can operate, but it's just closed. The operation has been closed, called as physiological shutdown. Anatomically, it has to fuse and go into permanent. So that time we call it as the anatomical closure, we call it as a fossa ovalis. Okay. So ductus arteriosus usually 10 to 15 hours, max to max within the first 48 hours it has to close. Anatomically by 21 days. Okay. Now, anatomically, once the ductus arteriosus closes, it will become into ligamentum arteriosum. Again, this is also important. Ligamentum arteriosum. Okay. All right. There is umbilical vein. Umbilical vein are also called as ductus venosus. This ductus venosus will close anatomically by 3 to 7 days. We call it as a ligamentum venosum. So artery ka beech ka connection, the communication between two arteries is called as the ductus arteriosus. That closure we call it as a ductus arteriosus closure that will lead to ligamentum arteriosum. But here we call it as a ligamentum venosum. Okay. Umbilical artery, immediately it will close and it will become a medial umbilical ligament. Umbilical vein immediately become into ligament teres. Okay, umbilical vein becomes into ligamentum teres. Okay, so if there is a defect of any of these closures, it will lead to congenital heart defects. What is this? Congenital heart defect. For every congenital heart defect, भाई नाडा टाइट से बांध के रखो, एक क्राइटेरिया यूज करते हो, नाडा क्राइटेरिया. ठीक है, नाडा क्राइटेरिया. वी यूज है नाडा क्राइटेरिया. सो नाडा क्राइटेरिया के अंदर रूल है, एक बात देख लो. मरमर, जो भी मरमर्स होते हैं ना, दे हैव डिफरेंट ग्रेड्स. सो ग्रेड 1, ग्रेड 2, ग्रेड 3, ग्रेड 4, ग्रेड 5, 5 ग्रेड्स ऑफ मरमर्स होते हैं. ओके, बट अकॉर्डिंग टू नाडा क्राइटेरिया, कभी भी कंजेनिटल हार्ट डिफेक्ट बोलोगे तो प्लीज लिसन टू मी. डायस्टोलिक मर्मर ऑफ एनी ग्रेड, systolic murmur of more than grade 3, baby has a cyanosis or a heart failure. So these suggestive of congenital heart defect. These are the major criteria. अब चलते हैं माइनर क्राइटेरिया. माइनर क्राइटेरिया के अंदर सिस्टोलिक मर्मर लेस देन और इक्वल टू ग्रेड 2. ओके, यस टू अबनॉर्मलिटी. सेकंड हार्ट साउंड में कोई अबनॉर्मलिटी हो गया, चेस्ट एक्सरे में चेंज है, बीपी में चेंजेस है, तो इसको बोलते हो नाडास माइनर क्राइटेरिया. सर याद रखना है, कोई दिक्कत नहीं, हो पाए तो करो, नहीं तो इतना भी छोड़ दो कि इतना तो याद हो जाएगा ना, नाडा तो याद होगा ना, ये तो बांधना तो नहीं भूलेंगे ना. तो नाडा एटलीस्ट याद रखो. नाडास क्राइटेरिया इज यूज्ड फॉर डायग्नोसिस ऑफ व्हिच ऑफ द फॉलोइंग डिसीजेस, यूज्ड फॉर द डायग्नोसिस ऑफ कंजेनिटल हार्ट डिफेक्ट्स. ओके, अगर एक मेजर और दो माइनर, एक मेजर या दो माइनर, एनीथिंग इफ इट इज प्रेजेंट वी कॉल इट एज अ कंजेनिटल हार्ट. अब आते हैं द मेजर सोर्स, major MCQ portion. So before going into this major MCQ portion, so we'll take one small break of 10, let's take about 15 minutes. Okay, so 15 minutes means by 6:22 we will start. Okay, let's take a small break of 15 minutes. Why am I giving this break? Quickly recap these things, whatever I taught so far from the cardiovascular system के अंदर मैंने जो भी पढ़ाया था, क्विकली एक बार रिवाइज कर लो या वीडियो को बैकवर्ड करके देख लेना, फिर आके मैं करवाता हूँ तुम लोगों का ये चीज. बिकॉज अगर वो रिवाइज नहीं हो पाता है तो मैं इतना सब करके कोई फायदा नहीं है. ठीक है, मैं इतना गारंटी दे सकता हूँ कि यार आफ्टर दिस 3 आवर तुम पीडियाट्रिक्स को टेंशन लेने का जरूरत नहीं. ये मेरा गारंटी. ठीक है. All right, everybody is back. चलिए शुरू करते हैं. Let's start. If everybody is back or not, come on, respond. मुझे पता है कम लोग ही मतलब YouTube live से देख रहे हो, but still, whoever is there, if you're back or not, just give me a response, please. Okay, perfect. Let's start. So what I'm trying to tell you is congenital heart defect. So congenital heart defects के अंदर, so what we had to understand one important aspect. We had, बढ़िया यार, thank you, feels really great, thank you. Now सुनिए, तो congenital heart defect, if one minor NADA criteria or one major NADA criteria or two minor is there, we call it as a congenital heart defect. So congenital heart defect can be classified into two types. What is this two types? Cyanotic heart defect and acyanotic heart defect. Now cyanotic का मतलब क्या है? In this type of heart defect, baby will develop cyanosis. मतलब baby क्या हो जाएगा? Baby will have a bluish discoloration of the skin. So कब होता है? Now remember, cyanosis will occur whenever there is a deoxygenated blood accumulation. Wherever there is a deoxygenated blood, वहां पे क्या होता है? Cyanosis होता है. तो cyanotic heart defect will have one important point, that is right to left shunt. When there is a blood, if it goes from the right part of the circulation, if it goes into the left part of the circulation, there will be cyanosis. So acyanotic heart defect. Acyanotic heart defect मतलब, let's take one right atria, right ventricle. Okay, then left atria, left ventricle. Okay, now if the blood goes from right part of the circulation to the left part of the circulation, then cyanosis. If vice versa, from the left part of the circulation, if it comes into the right part, then there is no cyanosis, called as a acyanotic heart defect. Okay, so acyanotic, left to right, cyanotic, right to left. Okay, so the defects are atrial septal defect, venous ventricular septal defect, patent ductus arteriosus and coarctation of aorta. These are acyanotic heart defect. But cyanotic heart defect में आता है tetralogy of Fallot, transposition of great vessel and TAPVC and hypoplastic left ventricular, जिसमें left ventricle is not formed completely. It is not so important. कभी होते हैं, वो भी गलत हो रहा है, बहुत घबराहट हो रही है. So देखो, जब क्वेश्चन लगाते हुए अब गलती हो रहा है तो नोटिस करो कि कैसा तरीके का गलती हो गई. ठीक है, द थिंग इज दैट कि हम लोग मान के चलते कि लाइक आई विल गिव यू वन रियलिटी. ओके, ये समझना चाहिए. ठीक है, मैं तुम्हारा परेशान समझ गया. आई विल टेल यू द सॉल्यूशन. तो मान के चलो तुमने सॉल्व किया, यू प्रैक्टिस्ड 1200 क्वेश्चंस. जस्ट इमेजिन यू प्रैक्टिस्ड 1000. In this 1200 question, let's imagine you made 500 mistakes. 500 were wrong. Now think about this. In this 500, will all the 500 come in your exam? नहीं है ना. गलती होता है तो होता है, पर इसका मतलब ये नहीं है कि वो वही क्वेश्चन तुम्हारा एग्जाम हॉल में भी आएगा. ठीक है, थोड़ा तो कॉन्फिडेंस रखो, थोड़ा बिलीव करो कि तुम मेहनत किए. ओके, यू गेट माय पॉइंट. See, that is the thing ना, ज्यादा सोचने का. Once you know the answer, just mark it and move further. Don't think much, because हम लोग आंसर लगा के भी फिर ये भी हो सकता है कि सोच लगाते. ये गलत नहीं करना. ठीक है डॉक्टर साहब, अब इसके बारे में और भी डिस्कस करता हूं मैं. आई विल रिमेम्बर दिस बाय द एंड ऑफ आवर लेक्चर, है ना. थोड़ा यहाँ पे विल डू द लेक्चर, देन आई विल हेल्प यू विद इट. ओके, चलिए. तो फर्स्ट एंड मोस्ट इंपॉर्टेंट, लेट्स स्टार्ट विद द cyanotic heart defect. cyanotic heart defect के अंदर there is a bluish discoloration of the skin. अरे the first important, there is a tetralogy of Fallot. tetralogy of Fallot means there are 4 defects are there. ये इमेज के अंदर ही तुम्हें समझ में आ ही जाएगा. ठीक है, देखो नॉर्मली यू हैव योर लेफ्ट एट्रिया, लेफ्ट वेंट्रिकल. फ्रॉम द लेफ्ट वेंट्रिकल कौन शुरू होना था? aorta. what should be going there? aorta from the left. Instead of that, aorta, if you notice, aorta is going from the right ventricle also, left ventricle also, means there is a overriding of aorta. Okay, overriding of aorta. Overriding of aorta, and also if you notice here, so since aorta came to the right ventricle, pulmonary valve has got narrowed, that is having a pulmonary stenosis. Pulmonary stenosis. Okay. then because now look here, यहाँ पे तो hypertrophy हो गया, resistance बढ़ गया, means the right ventricle has to work more. So look here, the right ventricle undergone hypertrophy, and also there will be ventricular septal defect. So for defect, pulmonary stenosis overriding aorta, then right ventricular hypertrophy and ventricular septal defect, ये चारों साथ मिलेगा, तो that is called as tetralogy of Fallot. Okay, now so when there is a pulmonary stenosis and overriding of aorta, right ventricle के ऊपर load क्या होगा, बढ़ेगा, that will lead to right ventricular hypertrophy and ventricular septal defect also will be there. Okay, so that is a point to be remembered. So blood is going from where to where? From the right part of the circulation, from right ventricle blood is going into the aorta, so automatically what will be there? Cyanosis will be there because deoxygenated blood is going. Okay, so clinical feature, baby will have TET spell, TET, ध्यान से सुनो, spelling मत बदलना इसका, ठीक है, बहुत गलत मतलब हो जाएगा, ठीक है. So baby will have something called as TET spell. What is that? TET spell are nothing but cyanotic spell. Means baby will be normally sitting, okay, nothing will happen to the baby, but suddenly as if somebody has put a blue color dye on the baby will develop what? Crying and cyanosis like this. Okay, now if you do this movement, so if you put the baby's knees to the chest, if you put like this, knees to the chest, cyanosis क्या होता है? Disappear. What will happen to cyanosis? Disappear. Okay, so diagnosis के अंदर best investigation of choice is always echocardiograph, and in the chest x-ray you find a boot shaped heart. Tetralogy of Fallot patient will never get a heart failure. You can see this boot shaped heart. So boot shaped heart is the indicator of tetralogy of Fallot. Okay, so treatment, medical management में beta blocker देते हो. Okay, if the baby undergoes hyperventilation and also baby can also have other problems also like metabolic acidosis, alkalosis, etc. Okay, then the best treatment will be surgical treatment. इसमें क्या क्या याद रखना है? The drugs used is beta blocker, we get a boot shaped heart, we have 4 defects, cyanotic heart defect is the tetralogy of Fallot. Done. Let's go to the next important aspect. What is that? That is tricuspid atresia. So tricuspid atresia, what happens is that we have a tricuspid valve, right? Tricuspid valve is not properly formed. That is only tricuspid atresia. So that is not a great important, but the most important one is transposition of great vessel. पहले तो एक anatomically देख लेते हैं. So we have normal image, left ventricle. From the left ventricle, if you notice here, what is going on? Aorta is coming. From the right ventricle, who is coming? Pulmonary artery. But instead of that, aorta will start from the left ventricle, pulmonary artery will start from the right ventricle. That is only transposition. Matlab one artery to another artery they have transposed. In a normal person, from the left ventricle, aorta will start, and from the right ventricle, pulmonary artery will start. But instead of that, from the left ventricle, pulmonary artery शुरू हो जाता है. From the right ventricle क्या शुरू हो जाता है? Aorta शुरू हो जाता है. When there is a start of aorta from the right ventricle and from the left ventricle pulmonary artery, then we call it as a transposition of great arteries. So what will happen? Switching of the pulmonary artery and aorta. Normal से अलग हो जाता है. So because of that, what will happen? Let's see. Okay. पहले left ventricle था. From the left ventricle, blood will go to where? Pulmonary artery. Normally, blood was supposed to go into the aorta, but instead of that, now pulmonary artery has started from the left ventricle. So, from the lung, blood will go to pulmonary artery. From the pulmonary artery, blood will go to lung. From the lung, pulmonary vein. From the pulmonary vein, it will go to left atria. From there, left ventricle. Then it will go to pulmonary artery again. So the problem is blood will come from the left ventricle, go to the lung and come back to the left ventricle. This is what is happening. And in the from the right ventricle, what has started? Aorta. From the aorta will go to the tissues to the veins to the vena cava to the right atria to right ventricle. This is what is going on. Okay. So now what happened is that systemic circulation alag ho gaya, and also pulmonary circulation is separated. So that time only communication we have left out is ductus arteriosus. What is this ductus arteriosus does? All of us know, right? Ductus arteriosus is present between the pulmonary artery and aorta. So ductus arteriosus will be the only communication at this point of time. Okay. So that is your transposition of great arteries. Okay. So during the intrauterine life, be ready. If you find the diagnosis, you made the diagnosis during the intrauterine life, means immediately keep all the equipment required for the surgery by the time of birth. Okay, immediately after the birth, what we are supposed to do? See, normally, physiologically, any person after birth, ductus arteriosus will start to close. Now, what we have to do is that keep the ductus arteriosus open. This is a point to be remembered. Ductus arteriosus must be kept open in a transposition of great vessel patient. Pura statements in the transposition of great vessel patient. Okay, so immediately after the birth, what exactly we are going to do to keep the ductus arteriosus open? We use a drug called as alprostadil, called as it is a prostaglandin even analog, followed by that immediate surgery. Okay, so if you do a chest x-ray, you can find the appearance called as a egg on the string appearance. Like this appearance can be seen. Okay, diagnosis will be made with the help of a echo. Then let's go to the next one called as the TAPVC, total anomalous pulmonary venous circulation. So normally pulmonary veins kaha jata hai? Where will pulmonary veins? Where they will go to left atrium. Okay. But in pathologically, what can happen is that pulmonary veins can go connect to the superior vena cava or they can connect to the inferior vena cava. ओके, पल्मनरी वेन जाना कहाँ पे था? जाना था उसको लेफ्ट एट्रिया पे. इंस्टेड ऑफ गोइंग टू लेफ्ट एट्रिया, इट विल गो टू ईदर सुपीरियर वेना कावा और inferior vena cava. So automatically because of that, excessive blood flow will be there in the lung. Pulmonary circulation में blood flow बढ़ेगा. That will lead to appearance called as ground glass appearance. What is that? Ground glass appearance. Ground glass appearance ये सारे condition में दिखता है. COVID-19, atypical pneumonia, pulmonary edema, ARDS. Okay, but here you need to understand what exactly is the cause. Okay, so plainly ground glass appearance दिखते ही ये मत बोलना TAPVC. Ground glass appearance is one of the symptom of TAPVC. Okay, so if there is a infracardiac TAPVC, मैंने बोला ना, if the pulmonary veins open into the inferior vena cava, then you can get a snowman appearance, or also called as a figure of 8 appearance. Snowman appearance or a figure of 8 appearance. Okay, चलो let's go to the next one. ये साइनोटिक हार्ट डिफेक्ट, जहां पे साइनोसिस नहीं होता है. यहाँ पे शंट विल बी व्हाट टू वेयर फ्रॉम द लेफ्ट टू द राइट. ओके, सो द फर्स्ट वन इज एट्रियल सेप्टल डिफेक्ट. सो देयर इज व्हाट आई एम टेलिंग यू, देयर आर टू एट्रियस. ओके, नाउ आफ्टर द बर्थ व्हाट इज हैपनिंग इज दैट देयर इज वन सम डिफेक्ट. सो जिसके वजह से क्या होता है, आफ्टर द बर्थ व्हाट विल हैपन, ब्लड फ्रॉम द लेफ्ट एट्रिया विल गो टू द right atria. Blood from the left atria will go to the right atria. From the right atria to right ventricle, then to the pulmonary veins. From the pulmonary veins, it will go to the lung. So remember what will happen in a acyanotic heart defect. More blood will come from the left atria. So automatically more blood flow to the lung. A lung will have a congestion. So because of the congestion, the child will have a recurrent chest infection. Mostly symptoms nahi dikhega. Only symptoms some of the ASDs will have is a recurrent chest infection because of the congestion in the lung. Okay, so normally treat the infection, decrease the load, use the diuretics, but surgical treatment we have a ASD closure device. So best treatment is surgical treatment, but to decrease the load we can use the diuretics. Okay, now in all the ASD there is one characteristic point to be remembered: wide splitting and wide S2. Second heart sound will split, especially with second heart sound P2. Okay, we have P2 and A2. In that second heart sound P2 will split. At least you remember fixed splitting of S2. अगर तुम्हारा एग्जाम के क्वेश्चन में fixed splitting of S2 is given, that is a rule that the answer is your atrial septal defect. Let's go to the next one, ventricular septal defect. Ventricular septal defect can be two types: muscular and membranous. Again, here also no major symptoms. So what happens, instead of atria, both ventricles are sitting like this. So from the left ventricle, blood will go to the right ventricle. Again, hello. So again, there is no what? There is no cyanosis, because of which symptoms might not be there. So if symptoms are not there, only thing what is going to happen, blood from the left ventricle will go to what? Will go to the right ventricle. More blood flow to the lung. If there is more blood flow to the lung, automatically what is going to happen? Is more blood flow to the lung, congestion and chest infection. It can be two types, muscular and membranous. Muscular one will close during the systole. मतलब क्या होता है, when muscle contracts, वो gap जो होता है बंद होता है. जब ventricle contract, gap बंद होता है. So that won't be a big issue. But membranous is most dangerous. Diagnosis will do with the echo only. So this is only right ventricular outlet and right ventricle and left ventricular outlet. that will be what is happening. There is a septal defect. Yes, I will do all the suggestion. First, let me get through with the pediatrics. I want to give a message to all of you, and I'll tell you how to handle yourself also at the end of the lecture. There's no doubt about it. Okay, I'll tell you everything. Then let's go to the next one. What is that? What is that? That is coarctation of aorta. What is this coarctation of aorta? Coarctation of aorta में देखो यहाँ पे क्या हो गया. So the aorta, whatever is there, the aorta, after this blood vessel, there is a narrowing of the aorta. Narrowing of the aorta. मतलब देखो upper limb का circulation for upper limb, head, neck and upper limb. ये तीनों का circulation तो यहाँ से ही आता है ना. यहाँ से ही आता है. Okay, so you have carotid arteries, you have what is that? You have your all the arteries which are coming to your brachiocephalic trunk. Everything comes from here only. So after these three branches, what is there? Narrowing is there. After these three branches, what is there? Narrowing is there. If after these three branches narrowing is there, so upper body will have a normal blood supply. In fact, because of this narrowing, more blood will go to the upper part of the body. It will increase the BP in the upper part of the body. Upper part of the body increase BP. Lower part of the body means if you check the lower part of the body, that is in the legs, there is a decrease of BP. There is a decrease of BP. Okay. So after the arch, there is a stenosis. So lower body will have less blood supply, upper body will have more blood supply, and because of that lower body weakness and on examination, increase BP in what is that? Increase BP in the upper arm. Hypertension is the most common sign of coarctation of aorta. So बच्चों को कब पता चलेगा? Hypertension के time पे. Okay. So what is the complaint? बच्चों को लेके कैसा आएंगे mother? Mother will bring the child only when baby will have what is that? He is not able to walk fast. He is not able to run. थोड़ा चलते ही वो बोलता है कि और मेरे से नहीं हो पाएगा. I'm not able to run any further because the blood supply is not sufficient for the lower limb. So that is the thing. Okay. So increase of BP. On the chest x-ray, we find something called as rib notching and rib ulceration, especially in the inferior part of the rib. I'll show you the images. Investigation of choice is echo or angiography can be done. So you can look here. In that image it is not so clear, but if you look here in the bottom there is an ulceration. See, look here. So evenness is not there. Look here, evenness is not there. Okay, so this is what is the symptom of your coarctation of aorta. Okay, let's go to the last and most interesting disease, that is patent ductus arteriosus. Okay, what is this patent ductus arteriosus? Patent ductus arteriosus is such a type of thing. So normally ductus arteriosus क्या होता था? बंद होता है. In a physiological, in a healthy child बंद हो जाता है. But if the ductus arteriosus remain open, अगर वो open रह जाएगा तो क्या बोलते हो? If it remains open after the birth, then we call it as what? Ductus arteriosus, patent ductus arteriosus. Okay, so because of which देखो ये होता है. Aorta ऐसा रहेगा. You'll have your aorta like this. You'll have your pulmonary artery like this. Pulmonary artery. Now the ductus arteriosus is open. Ductus arteriosus is open. Now if the ductus arteriosus is open, every continuously, because aorta has a high pressure, pulmonary artery has a low pressure, continuously blood will be flowing from aorta to the pulmonary vein, pulmonary artery, not pulmonary vein, pulmonary artery. Continuous blood flow going to the pulmonary artery creates a continuous machine like murmur. If you hear this word continuous machine like murmur, सीधा आंख बंद करके mark the diagnosis as your patent ductus arteriosus. Or also there is one more, but the other name for this only called as systolo-diastolic murmur, means continuously murmur रहेगा. Systole में भी रहेगा, diastole में भी रहेगा. Okay. So automatically, continuously blood flow is going to the pulmonary artery. There is more blood flow to the lungs. So automatically, the chest infection will be the most common symptom. Okay. So treatment क्या है? So वहाँ पे earlier in the patent ductus arteriosus, so we have to close the duct. But in one condition, in the transposition of arteries, we have to keep the ductus arteriosus open. Open रखने के लिए alprazolam दिए थे. That is a prostaglandin analog. But here, what you are going to give, you can give either ibuprofen or indomethacin. Ibuprofen or indomethacin. Okay, so we can use indomethacin. Okay, now best treatment is coil closure of PDA. Best treatment is PDA closure device, coil closure of PDA. That is the surgical treatment what you are going to do. Okay, then let's go to the next one, that is only called as Eiser-Menger syndrome. Eiser-Menger syndrome, what will happen now? So there is one left to right shunt. Let's take ventricular septal defect. So ventricular septal defect मतलब ऐसा हो जाएगा, है ना? So look here. So there is continuously blood was coming from the left ventricle to right ventricle. continuously blood is coming, continuously blood is coming. After 10 years of age, so right ventricle ke upar what has happened, load was increased. If more load, right ventricle will undergo hypertrophy. Now it will increase the pressure in the, very good, it will increase the pressure in the right ventricle, because of which now the shunt will reverse. Earlier left to right shunt, earlier left to right shunt becomes right to left shunt. That is only called as a Eiser-Menger syndrome. Eiser-Menger syndrome. Diagnosis usually clinical diagnosis only. Okay, so here I have put all the important points. Most common congenital heart defect is ventricular septal defect, increase the risk of endocarditis. Most common cyanotic heart defect is tetralogy of Fallot. Okay, fixed splitting of S2, atrial septal defect. Okay, then ventricular septal defect. What is that? That is sometimes third and fourth intercostal spaces we can get the murmur, but not mandatory. The congenital heart defect with hypertension is coarctation of aorta. Tetralogy of Fallot plus ASD is called as pentalogy of. ओके ये सारे एमसीक्यू, आखिर में कुछ नहीं आता, एटलीस्ट ये 4-5 पॉइंट रट भी लोगे तो ये क्वेश्चन आ ही जाएगा. Let's go to the next concept, that is pediatric neurology. So when we want to talk about the pediatric neurology, now listen to me very carefully here. So all the bones, where bones are meeting, we call them as sutures. When bones are meeting, we call them as sutures. The empty spaces, openings are called as fontanelles. So we have anterior fontanelle, we have posterior fontanelle. Okay, so remember, anterior fontanelle closes by 18 to 34 months. Okay, and posterior fontanelle closes by 0 to 3 months. Okay, mastoid one by 6 to 18 months, and scaphoid one by 3 to 6 months. Among which, what is the most important? Posterior fontanelle, when it will close. Posterior fontanelle will close in 0 to 3 months. Okay, all right. Let's go to the next one. All the central nervous system is developed from the neural tube only. It closes by 3 to 4 weeks of intrauterine life. For the development of neural tube, हमें क्या चाहिए? Vitamin B9. If there is a vitamin B9 deficiency, or for example any other things, it will lead to neural tube defect. Okay, so we can do the diagnosis during the intrauterine life itself by amniocentesis. We can check for ACHE level and alpha fetoprotein level. These are the markers for the neural tube defect. Okay, so neural tube is the one which is responsible for the development of brain and spinal. Okay, let's go to the next one, neural tube defects. हाँ, मैं काफी स्पीड जा रहा हूँ, मुझे पता है, but what to do, we have very short time, and that's how it has to be done before the exam. Now we have neural tube defect. So we have neural tube defect, we have something called as the cranioscasis. Okay, so all the craniospinal defects. Okay, so listen to me. So let's start with the cranial one. So cranial one, if open neural tube defect is there, we call it as a anencephaly. So if they give you the picture, write like this directly, remember anencephaly. Okay, then there is a cranial one only, open one, called as encephalocele. Encephalocele means brain is coming out, brain tissue is coming out. Then we have spinal. Spinal also, we have spina bifida. So in the spina bifida, we have, what is that? We have, what is this? Hair like projection, or that can be present. Okay, then we have closed spina bifida, sclera bifida cystica, that is only your meningocele and meningomyelocele. In meningocele, what happens is that outpouching ones are only meninges will come out. Okay, but here what will come out is outpouching is there, but along with that spinal cord is also coming. We call it as a meningomyelocele. Okay, then there is one more condition called as inencephaly. What is inencephaly? Brain and occiput both are not formed, very rare. Okay, so you don't have to know also, fine. Now, microcephaly and macrocephaly. What is microcephaly and macrocephaly? Let's see. Okay, so microcephaly means the baby's head is smaller than the normal. If it is less than 35 centimeters, and remember, less than 3 standard deviation. Okay, then we have head size more than 35 centimeter, called as macrocephaly, or more than 3 standard deviations. Okay, so microcephaly can be caused by what? Microcephaly can be seen with Turner syndrome, torch infection, hypoxic ischemic encephalopathy, and fetal alcohol syndrome. Okay, Now, macrocephaly most commonly caused by hydrocephalus. Hydrocephalus matlab there is an increased amount of cerebrospinal fluid. There is an increased amount of cerebrospinal fluid. Or also it can be caused by leukodystrophy and deposition diseases can also lead. Okay. Then let's go to the next one, hydrocephalus. When we are talking about hydrocephalus, first let's start with the CSF formation, means cerebrospinal fluid formation. So cerebrospinal fluid formation starts from the choroid plexus. From the choroid plexus, whatever cerebrospinal fluid is formed, it will go to the second ventricle of the brain and it will go to the third ventricle of the brain. Okay. From the third ventricle, between the third and the fourth ventricle, we have aqueduct of Sylvius. Through the aqueduct of Sylvius, from the third ventricle, it will go to the fourth ventricle. From the fourth ventricle, it will go into what is that? Subarachnoid space. Okay. Now, if this aqueduct of the Sylvius is narrowed, means aqueduct of the Sylvius is closed, so CSF will be formed, but it will come only till the third ventricle. So what will happen? More fluid accumulation will be there in the brain, leading to enlarged head. Okay. Then acquired causes. So that is a congenital cause, and we have an acquired cause. What is this acquired cause? Means after the birth also there can be some infections like mumps and toxoplasma. They can also cause hydrocephalus. Okay. Then non-obstructive causes are most common cause is subarachnoid hemorrhage. Subarachnoid hemorrhage is the most common cause of macrocephaly. Okay, or hydrocephalus. Okay, let's go to the next one. These are some congenital malformations. इस चीज को बहुत अच्छे से याद रखना होगा. What is this? So we have Arnold-Chiari malformation. What is this? Arnold-Chiari malformation. So first let's look here, my dear students. This is the anterior skull fossa, this is a middle one, and this is a posterior fossa of the skull. Now what happens here is that the posterior fossa will be very small. Since the posterior fossa is very small, now cerebellum cannot sit in the brain. So cerebellum will herniate from the foramen magnum, means cerebellum will come out of what? Cerebellum will come out of the brain. So that is only called as Arnold-Chiari malformation, means small posterior fossa, because of which there is no space for the cerebellum. Cerebellum will come out of the brain. We call it as a Arnold-Chiari malformation. So Arnold-Chiari malformation type 1. Here we will have Arnold-Chiari malformation plus hydrocephalus only. But here hydrocephalus plus meningomyelocele can also be present. But इसमें क्या याद रखना है? सर याद रखो Arnold-Chiari malformation. Arnold-Chiari malformation means small posterior fossa, because of which cerebellum is herniating. Let's go to the next one. That is only called as a Dandy-Walker syndrome. What is this Dandy-Walker syndrome? So there is a cyst-like lesion. What is a cyst-like lesion in the fourth ventricle? Cyst-like lesion in the fourth ventricle. So it will compress the cerebellum. If cerebellum is compressed, what is going to happen? Automatically there is no balance. So here you can see a fluid-filled lesion in the fourth ventricle, which will lead to what? Cerebellar compression. Okay. All right. You can notice here Arnold-Chiari malformation. What is happening? A part of the cerebellum is coming out of the brain. Okay. So that is the story of your congenital malformation. Let's go to the meningitis. Meningitis means what? Inflammation of meninges. Inflammation of meninges, what are the causes? It can be bacterial, it can be viral, it can be fungal. Okay. Most common cause of the neonatal meningitis is Staphylococcus aureus. Okay. Then other ones are E. coli and also Neisseria meningitidis can also cause meningitis. Okay. Now in this, my dear students, we have viral also, we have fungal also. Now before going to any other thing, in the viral meningitis, the best investigation is always polymerase PCR. Okay, always PCR. Here glucose can be normal or increased, protein will be normal or increased in the cerebrospinal fluid. Means if viral meningitis is there, glucose will be normal or increased, protein will be normal or increased in the cerebrospinal fluid. Okay. Fungal is seen only during the immunocompromised state. So it is usually seen with the cryptococcal meningitis. Okay. So all the people who is having meningitis have the common clinical features such as fever, neck rigidity, projectile vomiting and headache. Okay, necroticity, projectile vomiting and a headache. Clinically, we can see some signs. We have a sign called as Kernig sign and Brudzinski sign. Very important favorite sign of examiner is Kernig sign. What is that? Kernig sign. What is that? Kernig sign. So if you try to raise the leg of the baby, look here, if you try to raise the leg of the baby, baby will have a severe headache. That is only called as a Kernig sign. That is only called as a Kernig sign. That is very important sign for what is that? Meningitis diagnosis. Okay. So if at all investigation of choice means अगर कोई patient को लेके आते हैं, fever है, headache है, vomiting is there, you suspect meningitis. So if you suspect meningitis, the first investigation what we can do is investigation based on the lumbar puncture. Okay. So if it is a bacterial meningitis, what and all you can find. So it is a bacterial infection. Bacterial infection means neutrophils will come, pus cells will come. Pus cells means automatically CSF color will be changed to yellow in color. Okay. Now neutrophils release a lot of protein. Protein will also be increased. So how to differentiate? Now in viral meningitis also protein is increased, but utilize glucose. Glucose. Why? Because this is a bacterial condition. So bacteria for its survival, it will take up all the glucose from the cerebrospinal fluid. So glucose in the cerebrospinal fluid is reduced, means it is a bacterial meningitis. Okay. All right. So what we are going to do after that, we check for the microscopy. In the microscopy, what we can see whatever the bacteria is there. So if there is a gram-negative diplococci, that means it is a Neisseria. Gram-negative diplococci which causes meningitis is Neisseria meningitidis. So special clinical feature of the Neisseria meningitidis is coffee bean appearance of the bacteria. Rash is having a star-shaped rash. In the medicine I taught you people in endocrine. So star-shaped rash and internal bleeding due to meningococcal sepsis that can end up into Waterhouse-Friderichsen syndrome. So treatment for Waterhouse-Friderichsen syndrome will be IV hydrocortisone. We can also go for a culture. So in the culture, we can also go for a culture. But if it is TB meningitis, sir, TB meningitis hota to TB meningitis is a slow growing infection. So kaun badega? Lymphocyte badega. So though it is a bacterial, since it is a chronic infection, so always in TB meningitis, lymphocyte will be increased. So lymphocyte will be increased in TB meningitis and viral meningitis. Okay, lymphocytes are increased in TB and viral both. But in the TB meningitis, glucose will be decreased because all the glucose will be taken up by what? Your TB bacteria. In the viral does not depend upon the glucose. So normal or increase of glucose will be there. So this is a classic point to differentiate viral, bacterial and TB meningitis. Okay. So bacterial meningitis, for all other bacteria, you will have neutrophil elevation. For TB meningitis, lymphocyte elevation. Okay, in the viral meningitis, lymphocytes will be elevated, normal or increased protein. Diagnosis will be based on the PCR. For the fungal, it is totally different scenario. It is seen with the immunocompromised. Glucose will be decreased. Color depends upon the fungal infection. Okay, so let's talk about the cerebrospinal fluid. Okay, जो आप लोगों ने अगर cerebrospinal fluid लेते हो, तो in the cerebrospinal fluid normal color is transparent. अगर bacterial है yellow color. Okay, अगर straw color है viral meningitis भी हो सकता है, TB meningitis also possible because of the lymphocytes. Okay, now red color CSF means there is some bleeding into the cerebrospinal fluid. Cerebrospinal fluid is located where? In the subarachnoid space, so that is suggestive of subarachnoid hemorrhage. अगर protein इतना ज़्यादा बढ़ गया, very severe protein elevation you find, that is plus focal neurological symptom मिलेगा तो multiple sclerosis बोल सकते. Okay, so treatment for meningitis usually empirical antibiotic. भाई लोग याद रखो, empirical antibiotic के बहुत controversy चलता रहता है. It is cephalosporin, most commonly used is cephalosporin. उसके बाद culture sensitivity check करो, specific antibiotic शुरू कर सकते हो. Treat like every other infection. Okay, now let's go to the next most important. So Neisseria meningitidis का prophylaxis के लिए आप लोग rifampicin use करते हो, and drug of choice for Neisseria meningitidis is chloramphenicol. Okay, so meningitis, most common complication will be seizure, but there are other things also which can occur. For example, streptococcal plus meningitis is there, then SNHL can be there. Cerebral palsy can occur. Okay, then HIE can occur. Okay, Kernicterus infections, all of them can also be possible. Okay, so let's go to the next important aspect, that is pediatric nephrology. In pediatric nephrology, I'm not going to waste your time much by teaching you a lot of things. So all the congenital anomalies are discussed in the urology of the surgery. Okay, that is duplication urethra, PCKD, harshu kidney, all of these things. I want to teach you people only about the glomerulonephritis. In the glomerulonephritis, acute glomerulonephritis are usually PSGN, HSP, MCD, minimal change disease. Minimal change disease is the most common glomerulonephritis in the children. Okay, then we have chronic. Chronic glomerulonephritis, usually IgA nephropathy and MPGN, and subacute are also called as rapidly progressing. Rapidly progressing is RPGN, rapidly progressing glomerulonephritis. It will easily lead to chronic renal failure. Okay, so all of you know all these things. Patient with the glomerulonephritis can have nephrotic syndrome, nephritic syndrome, and uremic syndrome. Okay, so nephrotic syndrome तब भी बोलोगे when patient is having proteinuria more than 3.3 gram per day. अगर यूरिन के अंदर मोर देन 3.3 ग्राम पर डे इफ इट इज गोइंग, ओनली देन यू कॉल इट एज अ नेफ्रोटिक सिंड्रोम. एल्स क्या बोलते हो? प्रोटीन्यूरिया. नॉर्मल प्रोटीन लॉस कितना होता है भाई? नॉर्मली लेस देन 0.033 ग्राम पर डे. ओके, इतना ही प्रोटीन जा सकता है. इफ एनीथिंग मोर देन दैट अप टू व्हाट? up to 3.3 grams, we call it as what? Proteinuria only. But proteinuria, if it is more than 3.3, then we call it as a nephrotic range of proteinuria. So in the nephrotic range of proteinuria, and here in the nephritic syndrome, patient will develop hematuria. Hematuria will be there. Okay, now uremic syndrome is a clinical thing. Increase of urea level will be seen. Okay, so let's go to the next important aspect. For example, this is a very important question. A patient is having edema, hypertension, hematuria with 3.3 gram per day, 3.3 gram per proteinuria. So that time anywhere 3.3 is there, that means nephrotic syndrome plus along with that hematuria is there. You can't tell that nephronephritic syndrome, no, nothing like that. For example, hematuria is there but only 2.9. If it is less than 3.3 gram per day, then hematuria will give you the conclusive nephritic syndrome plus proteinuria, like that. Okay, so we have one of the most important non-immune system involving glomerulonephritis is your Alport syndrome, that is due to type 4 collagen defect. So in the Alport syndrome, you have this clinical feature. Remember, anterior lenticonus, so lens is bending forward to the anterior side, glomerulonephritis and sensory neuronal hearing loss, and also there will be what is that? Hemoptysis can be seen in the children. So this is your Alport syndrome, type 4 collagen defect. Okay, then let's go to the next one, IgA nephropathy, also known as Berger disease. It is क्या होता है कि पेशेंट को ना वायरल इन्फेक्शन होता है. वायरल इन्फेक्शन होने के 2-3 दिन के बाद patient will develop nephritic or nephrotic syndrome. Then we call it as a IgA nephropathy. In the IgA nephropathy, when you do the microscopy, you find what is that? That is mesangial proliferation and IgA deposits in the kidney. Okay, then we have PSGN. So PSGN after the sore throat. Remember, ये एक बात याद कर लो. See, after viral infection within 2 to 3 days हो जाता है, then it is IgA nephropathy. But here after the streptococcal infection, if there is a glomerulonephritis, then we call it as a post-streptococcal glomerulonephritis. That will lead to what? Nephritic syndrome. Treatment will be, best treatment is antibiotic. या हर साल ना ये लोग लड़ते रहते हैं, पहले बोलेंगे एंटीबायोटिक, बाद में बोलेंगे स्टेरॉइड. तो दोनों एक्चुअली क्लिनिकली साथ देते हैं, बट nowadays according to theory you need to remember antibiotics are the best drugs. Okay, then there is one more thing that is only called as congenital nephrotic syndrome. So in the glomerular basement membrane, we have two proteins called as nephrosin and podosin. Okay, nephrosin is coded by NPHS1 gene and podosin is coded by NPHS2 gene mutation. So अगर NPHS1 or 2 mutate होता है तो क्या होगा? Glomerulonephritis आएगा. Glomerulonephritis will be there. If it is NPHS1, then it is steroid sensitive. Steroid से treatment हो ही जाता है. But NPHS2 mutation, then it cannot be treated with the steroids. This is only called as Finnish type. बोलते हैं इसी को बोलते हैं Finnish type. Finnish type glomerulonephritis are also basket type glomerulonephritis. Okay, so these are the points must know from where? From your kidney. Okay, then let's go to the respiratory system. In the respiratory system, lot of it you studied from the ENT, but just I will talk about little bit. So what is this? So in the posterior side, we have one opening. So anteriorly we have nostrils, air will go inside. Posteriorly we have an opening called as covana, or cone. So this cone, if it is not formed, we call it as a atresia of the cona, congenital atresia of the cona. Okay, this is the most common congenital anomaly of the nose. Okay, so what will happen immediately after the birth? You try to pass the, what is that? That will be nasogastric tube if needed only. But only one thing you need to remember, most common is, what is that? That is your atresia of the cona. Okay, investigation of choice will be HRCT. Okay, let's go to the next one. Sounds of the respiratory system. We have stridor, we have wheeze, and we have a snore. Okay, we have a snore. Okay, first let's start with the strato. Let's start with the strato. Okay, what is this stertor? Stertor is nothing but snoring. Stertor is nothing but snoring. So it is usually due to nasopharyngeal obstruction. Nasopharyngeal obstruction like adenoid hypertrophy. तो बोलते हैं ना adenoids हो गए, tonsils हो गए. Okay, so that tonsil enlargement can lead to snoring called as stertor. Okay, then there is a stridor. Stridor मतलब the defect will go like this: nasopharyngeal area, then little bit lower to the throat, then little bit lower to the lungs. So if it is go to the vocal cord problem, then we get a stridor. Okay, noisy breathing, it usually seen with laryngomalacia. Okay, but if we are talking about a wheeze, then it is coming from the lower part, that is from the respiratory tract itself. It is usually wheezing sounds are seen with obstructive lung disorders. Okay, then let's talk about the common cold in children, most commonly caused by rhinovirus. Okay, and most common diarrhea in children is caused by rotavirus ke liye, so to prevent the rotavirus we give rotaviral vaccine. This rotaviral vaccine causes a hypertrophy of the Peyer's patches. So hypertrophy of the Peyer's patches will lead to intussusception. That is a most common one of the dangerous and commonest complications related to rotaviral vaccine. Okay, then we have next infection called as LTB, laryngotracheobronchitis, which is usually caused by parainfluenza virus. So parainfluenza virus, remember fever, cough, dry cough, barking cough, and a stridor will be there. Okay, epiglottitis mostly caused by influenza. Epiglottitis will be mostly caused by influenza. Okay, then let's go to the next one, that is only called as bronchiolitis. See, a bronchitis nahi, a bronchiolitis. Okay, now bronchiolitis is one of the common causes of wheezing in children. Okay, so it is caused by which virus? RSV, respiratory syncytial virus. So what exactly treatment we are going to? Symptomatic treatment, oxygen and ribavirin inhalation. A drug is there, ribavirin. So bronchiolitis is most commonly called by RSV, caused by RSV. Okay, चलिए आगे बढ़ते हैं. Next one, what is that? Croup is also called as laryngotracheobronchitis. Okay, so that is what laryngotracheobronchitis. So larynx, trachea and bronchus, all of them are inflamed, and the clinical feature will be subglottic stenosis, and the most characteristic sign is the croup का characteristic sign होता है barking cough. कफेता होता है barking cough. If barking cough is there, then the story is over. We are talking about what is that? That is your croup. Okay, let's talk about the next one, cystic fibrosis. So what is cystic fibrosis? It is a genetic disorder. एक gene होता है CFTR gene. So because of this CFTR gene mutation, we get cystic fibrosis. So cystic fibrosis में क्या होता है? Chloride channel ना काम नहीं करेगा because of the genetic defect. So if chloride channel does not work, then what will happen? A lot of sputum will start to accumulate, and motility of the cilia also will be affected. So usually child will have cough. Okay, purulent sputum and bronchiectasis in the respiratory tract. In the biliary tree, you will have cholestasis, and because of the pancreatic duct involvement, steatorrhea and deficiency of ADEK, and intestine will have meconium ileus. These are the common clinical feature, but in this, most importantly, remember, respiratory tract will have cough, very purulent sputum, and also bronchiectasis will be there. So diagnosis के लिए हम टेस्ट यूज करते हैं, very important test based on the sweat chloride test. Hमेशा we do one test called as sweat chloride test, and we give a treatment. These are the newer generation of drugs. They're called as chloride channel opener. Normally chloride channel dysfunction हो गया था due to which gene mutation? CFTR gene mutation. Now we try to open the chloride channel with the help of a drug called as ivacaftor and lumacaftor. Caftor, CAFTR. Ivacaftor and lumacaftor. These are the drugs which are used in cystic fibrosis, and these are the newer drugs. And cystic fibrosis earlier time में इंडिया में बहुत कम होता था, बहुत रेयर होता था. Nowadays slightly it is becoming मतलब slightly the cases are being seen. So that is why we must be aware that cystic fibrosis is a genetic disorder which occurs as a result of what? CFTR gene mutation. So this is the story of your, what is that? Story of your respiratory system and pediatrics का एक quick and rapid revision. ठीक है जी, मजा आए? आई नो दैट बहुत स्पीड गए हम लोगों ने, मुझे कोई दिक्कत नहीं. मुझे अगर कोई बोलेंगे कि सर आप हर सब्जेक्ट अच्छे करवा दिए बट इसमें थोड़ा स्पीड गए, इसमें कोई दिक्कत नहीं है. मेरा टाइम से ज्यादा आपका टाइम इंपॉर्टेंट है. अभी 2 days बिफोर द एग्जाम अब मैं समझाने के लिए बैठूंगा. दिस इज नॉट द टाइम टू डू दैट. ठीक है, आई विल बी वेरी ब्रूटली ऑनेस्ट अबाउट दिस. अभी बात करते हैं फर्स्ट. वी विल सर मेरा क्वेश्चंस का बहुत घबराहट हो रहा है. तो देखो यार, अब 2 दिन के अंदर तुम ज्यादा क्वेश्चन लगा के खुद को पैनिक में मत डालो. ठीक है, कहीं everywhere you have a great source called YouTube. There a lot of questions will be discussed. Just look at the discussion and go off. I'm hoping that आज तक अपने ऑलरेडी तुम लोगों ने ग्रांड टेस्ट वगैरह किए होंगे. अब नहीं किए हो तो अब कल परसों में मत किया करो. अब क्या ही हो जाएगा. अगर करना है तो करो, दैट इज अप टू पर्सनल विश. ठीक है, बट द थिंग इज दैट तुम्हारा ग्रांड टेस्ट और तुम्हारा मिस्टेक्स is not going to determine your final score. Remember, it will not determine your final score. आप एग्जाम के दिन वहां बैठने के बाद कितना अच्छे से रिकॉल कर पाओगे. रिकॉल कर पाओगे मतलब कुछ नहीं है. वहां बैठ के भी यू डोंट हैव टू रिकॉल होल 19 सब्जेक्ट. ऑल यू हैव टू रिकॉल इज द subjects question what you look at. Okay, and any suggestions before going to the exam hall? Yes, listen to me very very carefully. First and most important thing, okay, so the first and most important thing, always have your breakfast and go. कुछ ना कुछ खा के चले जाओ. ठीक है, एग्जाम हॉल में जाने के बाद आफ्टर यू गो इनटू द एग्जाम हॉल, प्लीज डू नॉट टॉक टू पीपल. क्योंकि आधा घंटे के लिए ना तुम्हें फ्रीली छोड़ देंगे. तुम बात करो, तुम इधर उधर करते रहो, तुम्हें जो करना है करो. यू डू वट एवर यू वॉन्ट, दे लेट यू फ्री. ठीक है, उस टाइम में क्या करोगे, दूसरों से बात करके आप पैनिक में चले जाओ. उससे बेहतर आइडिया है तो ऐसा बैठना, कोई कॉर्नर में कोने में कोई बंदा आ रहा होगा, जा रहा होगा. yes, maybe there is some girl sitting there. For girls also there is some and some boy sitting there. यहाँ पे एग्जाम के बारे में मत सोचना, चुपचाप ऐसे घूर के छोड़ो. क्यों बोल रहा हूँ पता है? दिस इज नॉट समथिंग रॉन्ग थिंग आई एम टेलिंग यू बिकॉज यू हैव टू कीप योर माइंड आउट ऑफ डिस्कशन देयर. ठीक है, वो जाने के बाद डिस्कशन नहीं किया करो एग्जाम हॉल के अंदर जाने के बाद. ठीक है, अब तुम लोगों को कोई कैलकुलेटर की जरूरत नहीं पड़ेगी, कोई पेन की जरूरत नहीं पड़ेगा, कुछ जरूरत नहीं पड़ेगा. एंड डू नॉट कैरी एनी इलेक्ट्रॉनिक डिवाइसेस बाय एनी चांस. डू नॉट कैरी एनी ऑफ दोस थिंग्स. ठीक है, वो सब तो वहां पे तुम संभाल लोगे. एंड द नेक्स्ट इंपॉर्टेंट थिंग, व्हाट एग्जैक्टली इज द नेक्स्ट इंपॉर्टेंट थिंग? देखो, फर्स्ट पेपर एंड सेकंड पेपर का बीच में तुम्हें सॉलिड 1 आवर तो टाइम मिलेगा. तो वो 1 आवर में थोड़ा बहुत खा के इमीडिएटली बैठ जाना है. थोड़ा बहुत सेकंड पेपर का इमेजेस वगैरह देखना है. इमेजेस ऑफ लाइक सर्जरी, गायनी, इफ पॉसिबल आर्थो, इफ पॉसिबल. ओके, इवन सर्जरी गायनी का इमेजेस से ज्यादा आर्थो का इमेजेस आपको मदद करेगा. थोड़ा बहुत ईएनटी देख लो, काम आएगा. ठीक है, वो करना है काम पे ब्रेक में. ठीक है, एंड दूसरी चीज, अब जाके कुछ नया पढ़ लूंगा ये सब कुछ मत किया करो. अब 2 दिन के अंदर जो पढ़ना है वो करके, जो पढ़ने का प्लान लगाए थे उसी हिसाब से चलो. ठीक है, एंड नेक्स्ट इंपॉर्टेंट थिंग इज दैट तो एग्जाम लिखते वक्त यू आर गोइंग टू फेस फ्यू प्रॉब्लम्स. व्हाट इज दैट फ्यू प्रॉब्लम्स? ऐसा होगा कि क्वेश्चन आएगा ना, फर्स्ट क्वेश्चन, सेकंड क्वेश्चन, थर्ड क्वेश्चन, फोर्थ क्वेश्चन, फिफ्थ क्वेश्चन, सिक्स क्वेश्चन, 7, ऐसे 7-8 क्वेश्चन कंटिन्यूसली. आपको ऐसा भी हो सकता है कंटिन्यूसली 4-5 क्वेश्चन का आंसर ही पता ना हो, तब भी मुझे याद कर लो, डरो मत. दिस कैन बी द स्ट्रेच ऑफ योर स्केरी पार्ट, दैट्स इट. क्योंकि एग्जाम के अंदर दो देयर आर 150 क्वेश्चंस इन ईच पेपर, तुम सिर्फ ये स्ट्रेच को देख के डर जाओगे. मतलब 4-5 क्वेश्चन का आंसर पता नहीं है तो कोई गलत नहीं है भाई, तो वो सबको होगा. ये स्ट्रेच, दिस विल बी द मोस्ट डिफिकल्ट पार्ट ऑफ योर एग्जाम एंड रेस्ट विल बी इजी, ये मान के चल लो. ठीक है, ये बात याद रखना. इसको देख के निराश नहीं होना है, इसको देख के निराश नहीं होना है. यू शुड नॉट फील सैड इफ यू डोंट नो आंसर फॉर कंटीन्यूअस 5 क्वेश्चन. डू नॉट गो टू द नेक्स्ट क्वेश्चन, गो टू द नेक्स्ट क्वेश्चन, एंड दैट्स अ वेरी 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 इंपॉर्टेंट थिंग. ठीक है, गो टू द नेक्स्ट क्वेश्चन, गो टू नेक्स्ट क्वेश्चन. ठीक है, जब तक तुम्हें 7-8 क्वेश्चन तक तो वो हो सकता है, हमेशा वो आएगा. ठीक है, so that is totally fine. You don't know a stretch of question, that is totally fine. Think about the rest of the question is still with you only to answer. ये बहुत अच्छे से याद रखो मेरा बात, ये पहली बात. एंड द सेकंड थिंग इज दैट यार, जब भी तुम एक क्वेश्चन, सी इफ यू डोंट नो द क्वेश्चन, ठीक है। यू डोंट नो मतलब ये कभी सुना नहीं हो, पढ़े नहीं हो, तुम्हें समझ में भी नहीं है, कुछ भी पता ही नहीं, आई डोंट नो व्हाट इज दिस, तो उसके ऊपर टाइम वेस्ट मत करो। डू नॉट वेस्ट योर टाइम ऑन द क्वेश्चन विच यू हैव नेवर हर्ड ऑफ, विच यू नेवर नो ऑफ। तुम्हें कुछ भी पता नहीं है ना, तुम उसको ज्यादा टाइम वेस्ट मत किया करो। 4 ऑप्शन है, ओके मुझे ये ऑप्शन सही सही लग रहा है, सही जैसा लग रहा है, लगा दिया, आगे बढ़ो, उसको बदलो मत प्लीज। अगेन आई विल टेल यू वन मोर थिंग, डू नॉट चेंज योर आंसर्स, इवन द गेस वन आल्सो, इवन द राइट वन आल्सो। प्लीज मिनिमाइज चेंजिंग आंसर्स एज मच एज पॉसिबल, ठीक है। ये आंसर गलत होने का मतलब बहुत टाइम क्या करते हो, सही आंसर लगाए होते, फिर बाद में यार कोई क्यों रिस्क लेना है, मैं बदल देता हूँ। भाई एक्चुअली तुम सही डाले थे, बदल दिया, सही आंसर से गलत में बदल जाएगा। तो इसलिए मैं बोलता हूँ कि वो बदलने का प्लान ही मत करना, ठीक है। डू नॉट चेंज योर आंसर्स, ओके। एंड इफ यू डोंट नो ए क्वेश्चन, टोटली फाइन। तो लाइक इट लिटरली तुम यू हैव नेवर हर्ड ऑफ दिस क्वेश्चन और दिस सिंड्रोम और दिस ड्रग और समथिंग लाइक दैट, then what you are supposed to do, whatever the beautiful thing you feel like answer, mark it and leave it, because most of the time your blind guess will be correct। ये मत बोलना लक वगैरह से ज्यादा अलग अलग फैक्टर्स होते हैं इसमें, ठीक है। मतलब तुम पढ़े हो इसको, कभी 12th में पढ़े थे, for example something you have studied in 12th, now your brain is telling this is the answer, you just mark it because your brain knows it but it cannot accurately place it where it is, okay। ऐसा भी हो सकता है, ऐसा brain will try to help you, ठीक है। बट क्या होता है, नहीं नहीं इसको ना मैं चेंज कर लूं, यार टाइम वेस्ट क्यों कर रहे हो, तुम्हें पता ही नहीं है, याद ही नहीं, कुछ नहीं आ रहा है, तो क्यों टेंशन ले रहे हो, उसको निकालो, उसको आगे बढ़ो, ठीक है। ये बहुत इंपॉर्टेंट चीज है। तो डू नॉट चेंज आंसर्स, रिक्वेस्ट नंबर 1, हाउ फुड एंड गो। when you don't know the answer, don't waste time on that question. If you don't know the answer, please always mark something, ऐसे blank मत छोड़ना, मैं बाद में कर लूंगा, तब कर लूंगा, ये कर लूंगा, वो कर लूंगा, हमेशा एक आंसर लगा के ही आगे बढ़ो, हमेशा एक आंसर लगा के ही आगे बढ़ो, okay। In the exam hall you will be able to do these few things। What is that, अगर among the 150 questions you will be able to, for example you are having whatever stretch of this thing is there, in that you will be able to put the question, matlab if you have not marked the answer, usually that question number will be highlighted with the red, if you mark an answer it will be with the green, if you put it for review it will be with the blue, but if you are putting a question for review, always mark an answer and put for review, always mark an answer and put for review। आप रिव्यू के अंदर डाला हुआ क्वेश्चंस विल बी कंसिडर्ड, ठीक है, बट आप बिना आंसर के रिव्यू में मत डालो, हमेशा कुछ आंसर करके रिव्यू में डालना, ठीक है। वेरी इंपॉर्टेंट थिंग। एंड नेक्स्ट इंपॉर्टेंट थिंग इज कि कोई भी क्वेश्चन आता है, प्लीज डोंट लीव इट अनआंसर्ड, ठीक है। हमेशा कुछ भी नहीं है, लास्ट एक से एक मिनट था, मेरे पास 2 क्वेश्चन बचा है, दोनों का आंसर पता नहीं, कुछ तो लगा, तुम्हें जो मन लगा लगा के आ जाओ, क्योंकि देयर इज अ पॉसिबिलिटी दैट यू कैन गेट, okay। So this is a story for your, this is a advice I can give you, and so whatever instructions given by NBE, follow that strictly, ठीक है। and most importantly do not carry any devices, and गलती से भी पॉकेट में रहना चाहे देख लीजिएगा, वो चेक कर लो, ठीक है। usually in front of exam centers you can leave your bags, so you would have arranged all of it by now, okay। so do very well, may God bless you with all the success, I pray for you people all the very best, एंड आप लोग इतने टाइम मेहनत किए हो, डेफिनेटली तुम लोग पास होंगे, ठीक है। तो हमेशा ये बात याद रखना, यू विल डेफिनेटली पास अनटिल एंड अनलेस ऐसा कुछ मैजिक होना चाहिए कि तुम्हारे अगेंस्ट इतना फोर्स होना चाहिए, उतना दम रखे, ठीक है। कुछ नहीं होगा भाई, एक एग्जाम है, डू नॉट वरी, हम इंसान है, एक एग्जाम बस, ठीक है। डरो मत, अच्छे से नींद करो, मतलब इसका मतलब ये नहीं कि 24 घंटा सो जाऊंगा, ये सब नहीं, 5-6 घंटे का नींद करो, थोड़ा बहुत अच्छे से खा लो भाई, हाँ बहुत इंपॉर्टेंट, ठीक है, स्पेशली ऑन द डे ऑफ एग्जाम। एंड प्लीज 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 ये डिस्कशन के चक्कर में बहुत ज्यादा परेशान मत हो, ठीक है। तो तुम्हें जो भी, अगर कोई पीडियाट्रिक्स छोड़ भी दिए थे तुम लोगों के लिए, तो काफी बढ़िया है, जो पढ़े थे आप लोगों के लिए एक बार क्विकली मैंने रिव्यू करवा दिया, ठीक है जी। So this is the story of your pediatrics, and with this much being said, I think for this session, this will be my, maybe this will be my last live for the upcoming 20th exam। So study very well, study very well, okay। Just जितना आप लोगों ने किए थे उसी को वापस करो, जो जो टॉपिक्स कंफ्यूजन थे उसको रिवाइज कर लो, ठीक है जी। So with that much being said, we'll conclude the class here for today. Thank you so much. Take care. All the very best. Okay. I pray for your success. All the best. Bye bye. See, that is what, na, that is what. See, I missed some question. Wait a second, guys. I missed some request. Any suggestions after that, sir? Should I take energy drink in break? So energy drink is up to your personal choice, my dear. I'm sorry, I didn't get the messages on my phone, so that were missed. I will answer your questions. Please don't leave. So energy drink is your personal choice. Okay. Then please upload the medicine. Medicine has been already uploaded, I think. PDF will also be uploaded right now. Okay. Then okay. सॉरी सर, ये बताओ क्वेश्चन नहीं आता है, उसको चेक कर रहे हूँ तो यार क्वेश्चन गलत होता है ना, इतना देख लो, उतना देख लो कि जब भी क्वेश्चन गलत होता है, डोंट वरी, तो जो पॉइंट तुमने गलत किए थे वो पॉइंट को सही से पढ़ लो, बस उतना ही, वही पॉइंट को सही से पढ़ के चले जाओ। और छोड़ के आगे नहीं बढ़ना है भाई, बिल्कुल ही नहीं बढ़ना है, छोड़ना ही नहीं है। अगर क्वेश्चन, यार क्वेश्चन सुने ही नहीं हो, तुम देखे ही नहीं हो, तुम्हें पता ही नहीं, कहां से आप मार्क करोगे? लॉजिक है ना, तो उस टाइम पे कुछ तो मार्क कर दो ना यार। एंड में टाइम नहीं बचा था, तुम वो क्वेश्चन में वापस नहीं आ पाए, कहीं मार्क मिस ना हो जाए, गलती से तुक्का लग गया भाई, एक मार्क आ गया, क्यों छोड़ना है? यू गेट माई पॉइंट डॉक्टर साहब, समझ रहे हो मेरा पॉइंट? ठीक है, तो प्लीज किसी को छोड़ना नहीं है। अगर कोई भी आंसर तुम्हें नहीं पता है तो सीधा कुछ ना कुछ मार्क करके आगे बढ़ो। ओके, सो दैट इज द इंपॉर्टेंट एडवाइस आई कैन गिव यू। ऑलराइट, ऑल द वेरी बेस्ट, थैंक यू, वी प्रे फॉर योर सक्सेस एंड डेफिनेटली ऑल विल पास। थैंक यू सो मच माय डियर स्टूडेंट्स। अच्छा, यहाँ पे कई कई कमेंट्स मुझे नहीं आया, अब भी आ गया, हाँ ये दिक्कत है। ओके, एंड डॉक्टर मेडिकोस, यू आर आस्किंग मी, सर शुड आई टेक एनर्जी ड्रिंक? दैट्स अप टू पर्सनल चॉइस. If you have a habit of taking energy drink and if you can handle the energy drink you take, if you didn't have an habit, experiment मत किया, कोई भी experiments नहीं है। Okay, so this is a story for our session. Bye bye.